Telling the untold.
Fault lines.
Live from the aggravated states of America, it is time now for the most curious morning talk show in the multidimensional space we call our world. Sitting on an independent rock, I am radio show host Shane Stranahan.
And in the left corner, I am the indefatigable, ever vigilant, a burning ember in the darkness, your political analyst, Jamarl Thomas.
Together, we are the disruptive duo that make up Fault Lines with Thomas and Stranahan. Moving quickly into the top headlines of the day before we get to Jamarl's monologue. First up in the news. After a group of 239 scientists sent a letter to the World Health Organization urging that they address airborne transmission of the airborne spread of the novel coronavirus. President Trump has also formally notified Congress and the WHO that he is withdrawing from the WHO, criticizing the organization's handling of the crisis. More to talk about there later at 7:30 with Dr. Mikhail Kogan. Texas is reporting more than 10,000 new coronavirus infections, a single-day high. The United States as a whole has also seen over 100,000 new infections by my counts, by the dashboard that I use in the last day. Coming back to Texas for a second, we've seen more hospitalizations doubling over the past week. We've also seen a total of 9,286 patients now hospitalized. They also saw their single highest death toll in a day yet. 60 people died from the coronavirus or its comorbidities in Texas in a single day period. So they're getting the triple whammy, more infections than ever, more hospitalizations than ever, and more deaths than ever. That is what you would expect to see, sadly. But again, this sort of breaks people's notions. We'll get more into that a little bit later. Dr. Anthony Fauci, has said he is strongly in favor of mandating mask use amid a rise in COVID-19 cases in Alabama and around the nation. Meanwhile, Georgia Governor Brian Kemp has said he would not support a government mandate on wearing masks. In Brazil, President Jair Bolsonaro has said he has tested positive with the coronavirus after suffering from a fever and muscle aches and going in for a lung x-ray. Brazil is second to the United States in the number of total deaths attributed to COVID-19. China has opened a new national security office in Hong Kong for the first time. Hong Kong's government has also banned children from engaging in disruptive political activities in schools and has specifically banned the singing in school of the pro-democracy song, quote, "Glory to Hong Kong," end quote. In Serbia, riot police have fired tear gas to disperse protesters who stormed parliament in response to the imposition of a coronavirus curfew in Belgrade, the nation's capital. Protesters said they were angry because the government eased restrictions to hold last month's parliamentary elections, spurring a rise in new cases. A report from Human Rights Watch said that more than 180 bodies had been found in mass graves in northern Burkina Faso, where government forces are fighting an Islamist insurgency. The group said the bodies appeared to be the result of extrajudicial killings by the army. Meanwhile, in Mississippi, a statue of former President Andrew Jackson, placed in 1822, will soon be moved from outside of the city hall. Again, this is in Jackson, Mississippi, a city named for the president. The city council voted 5-1 to remove the statue. But again, to repeat, the city itself is named after the 7th president. In our last story today, Major League Soccer begins its season tonight in Florida after the organization paused 4 months ago. The league's teams are sequestered in resorts for the duration of the tournament, which will be played without fans at ESPN's Wide World of Sports complex at Walt Disney World. With that, you are all caught up. That's the news. You're listening to Fault Lines with Thomas and Stranahan. So, Jamarl, what is your top priority for today?
So my top priority for the day is going to be involved in the COVID-19 issue. We have a situation where, as you noted, COVID-19 is basically spreading throughout the country. It is unrestrained. It is in full resurgence. And you can make an argument that it never actually subsided in the first place. And we're still in the first wave where the other countries around the world have basically been going down. I showed the clip yesterday where the gentleman was asked, Peter Navarro, why is it going up in the United States? To which he had all sorts of spin and everything else. But basically, the answer boils down to just utter, plain, complete, flagrant, breathtaking incompetence. And to make matters worse, there is no cavalry coming. The Trump administration is taking the official policy of basically letting the weak die off from this point on. Trump said we need to live with it. Now, last month in Axios, Trump was quoted saying, we have to get back to business. We have to get back to living our lives. Can't do this any longer, followed by the line that didn't age well at all. And I do believe it's safe. I do believe it's very safe. Well, you can take a look at the numbers that are around you. You can take a look at the media. You can take a look at the COVID numbers. That number is not safe. Those numbers have spiked into, over 3 million at this point, with over 130,000 deaths. And as the cases surge over 50,000 within the United States, Trump is taking an explicit policy that we need to move on. That, yeah, we may have these COVID meetings and whatnot, but we need to move on. There will be no talk of shutting down the economy anymore. The administration is going to tout various drugs and therapies, but ultimately that, no, we're not shutting anything down. Now, here's the catch, and here's the wild part about this. This comes after 6 months of ideologically driven, cantankerous prognostications that have all been entirely and completely wrong. Everything from we're going to be open by Easter, we're going to have packed churches. Everything from it's one person coming in from China, we have it under control, everything is just going to be fine. Everything from liberate, 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 when the various states were shutting down because their numbers were spiking several months ago. This has been Trump's policy. He's given an explicit care for economic concerns over the well-being of human lives. And what we're seeing now in Texas and Florida and all of these other states is emblematic of that. To make that worse, the reasoning that he's doing this must be understood and it must be accepted on almost like a gut level to realize how horrendous his decision-making is. Trump, in giving people $1,200, made the explicit assumption, or made the explicit belief, or took the explicit belief, that the economy matters more. And because the economy matters more, and because he's touted this over the course of his entire presidency, meaning you may not like me, but if I'm doing okay with the economy, you guys are going to give me a pass. Well, the economy has hit the bricks. And his thought is, I need to get the economy back up and running. He also has an owner class that is whispering in his ear, an owner class that has a very explicit interest that goes beyond just what the human being needs and goes directly into profitability. And because of such, he looks out at the world and he thinks, we got to get the economy going. Regardless of the people that it injures and kills, we got to get the economy going. That is his priority. And so he gives people $1,200. And in giving people $1,200, he knows that those people, many of which need to get back to work. He knows that many of those people are not necessarily getting additional income, that the bare income that they are getting is minimal at best, and is not necessarily making ends meet. In some cases, people, oddly enough, was making slightly more than their minimum wage, in which case they said, whoa, that's too much stimulus. That's too much stimulus. The thing is, you have a lot of people who are out of work. You have a lot of people who are desperate. And those people who are out of work and desperate will make a choice to go back to work in a hazardous situation if that means getting a paycheck. They would not take that choice if the United States government acted rationally, like the countries in Europe, most of the countries in Europe, and ensured that those people were made whole throughout the process to which they were out of work. Something that wasn't done by magic, something that was done because there was a pandemic an event that occurs from time to time. That's why they were out of work. It wasn't for a defect within the context of the job or a defect within the context of the society, even though our society has great and pressing flaws. You can see the people out on the streets because of it. But in this very specific instance, there was a virus. That virus created consternation within the course of, okay, we need to put this down, in which case people were stayed home. If you tell people to stay home, if you close businesses, you have a philosophical, not to mention ethical responsibility to ensure that those people are whole. And a good question should be asked is, if the government can't do the basics of ensuring that people are made whole, ensuring that people are made safe in the way that they go about their affairs at work, if they can't do that, then you have a problem with your government. And that's to put it mildly. Think for the moment of all of the energies that we put in to making this society what it is. You have everything that you do. The very fact that you're listening to me now, requires people to be manning Google, requires engineers to be at the place, requires me to be at my station, requires people who make coffee to energize me in mornings that I can't necessarily do that. If I walk out the house, if I go get something to eat, there's going to be people who make my meal or whatever. Not to mention the people who pave the streets, the people who make the air sure is clean, who prune the trees. You have a litany of things that take place throughout your entire world, big and small, some of which you don't even recognize, that require some sort of human labor, human intellect in order to accomplish. Your world is a representation of all the people and the labor that goes into making that world. We, in this country, in the United States, are blessed by that. You have a certain degree of environmental policy, you have a certain degree of workers' policy that have made our country, better or worse, what it is. With all of those people investing that much energy, mental and physical, into our process of making our world the way what it is, the taxes that people put into it, not to mention, like I said, the labor. You have a U.S. government who basically says, thank you for that, but no, we're not going to reciprocate in regards to making sure you're whole. Meaning, from the standpoint of the social contract, yes, we will take your taxes. Yes, we will take the labor that you invest into it. Yes, we will take your mental and physical energies, and we will put that to work in the interest of the country. We will do all that. We will expropriate 95% of the wealth to the top 1%. The moment, however, an emergency comes where you need that government to which you've invested all of that money and skill and practice and intellect into, we are just going to focus on the interests of one of the very specific classes, the 1%. And we're going to try to force you back to work, even if the conditions are not necessarily safe for you to do so. Something else also needs to be understood, that in the beginning of this, they could have chose to make sure people were whole and keep those people in their houses or social distancing for 2 or 3 months and then cut back on the economy where the numbers were less. You can look at what other countries did, that other countries were able to master this. All of this is incompetence. And now, once the incompetence is shown for what it is, he is now going to say, we need you to move forward and change the campaign message to, we need to move forward. I don't think that's going to work. You have a massive amount of population in this country that is terrified of getting ill. Even numbers have gone up from the standpoint of Republicans. Now, what this means is that if you're the president of a country that is terrified of getting ill, and your explicit policy has been to basically pretend as if that's not real, and in pretending that that's not real, forcing people into situations that those people know is real, you will pay for that. You will pay for that politically. And I would make the point that part and parcel to the reason why Trump's polling numbers has hit the skids on that is because he made a wrong choice. In prioritizing the economy, you chose something that the public wouldn't prioritize. When you ask the public, what should the president do? They are very clear that the government should take actions to put down the virus first before focusing too much on the economy. Because many of the people, believe it or not, are already working from home. So their priority is get rid of the economy. If you're older, get rid of the economy. Get rid of the disease. That's not what Trump is doing. And because he's not doing that, and because he's going against the prevailing wind and the prevailing notion of what the society wants, he will suffer for it. Now, there are X number of months left. He can do awesome in the debates. We are talking about Joe Biden. And so it's not necessarily, not saying there are chances. If Trump was running against a ham sandwich, I would say this race was over with, but he's not. He's running against Joe Biden. But that said, there's no help coming. And your government has gotten to the point basically where it is fully prioritized the interests of business and a small body of greedy human beings. And for that matter, his electoral chances of what he believes are his best electoral chances. Putting all of that on the line with the policy, let the weak die off, and is now running with this policy in regards to his re-election campaign. Shane, this is not competent governance in the least. And with all of the energies that the public puts into this country from the standpoint of social fabric, that goes both ways. That also demands that a government is competent in the leadership and that it takes care of the citizenry when the citizenry can't necessarily take care of itself.
Leadership is not at all competent in this country. We've established that very clearly, although you started your monologue off by saying there's no cavalry coming. I'm going to close on this before we go into our break. Maybe the cavalry is Kanye. Regardless, though, we can talk about that in just a minute. We're going into a break. You're listening to Fault Lines with Thomas and Stranahan. Be back in just a minute.
Fault lines.
By Any Means Necessary is your guide to the movement and efforts shaping the world around us, from mass incarceration.
No longer am I interested in or concerned with prison reform. I am interested only in the eradication of prisons.
To the battle between police and water protectors.
It was a pretty punishing disregard for the sanctity of human life, that unleashing water cannons on peaceful, prayerful water protectors.
From efforts to protect the environment.
The climate movement is ready to, with plenty of opposition research and force and strength, along with, the right of both science and morality, to fight them on this.
To the movement for Black Lives.
When I first saw the Michael Brown video, when I saw that it clearly contradicted the narrative put forth by the Ferguson Police Department and by police supporters in general, 3 words came to mind: color me shocked.
Stay tuned to By Any Means Necessary, 5 days a week here on Radio Sputnik.
Fault lines.
And we are back. You're listening to Fault Lines with Thomas and Stranahan. We're going to have an interesting conversation in this segment. I'm sure we're also going to be taking calls. 202-521-1320 is the number to call if you want to. Again, that's 202-521-1320. So, Jamarl, I'm going to put this out there. I'm going to put this on the table. The one thing, I've liked Kanye West's music. I've listened to that over the years. But the one thing that actually kind of piques my interest here is the weird stuff he's doing with shoes. So,
What do you mean?
just as So I don't know if you've heard about this, but Kanye West, for the past year, I forget when he first announced this, he's been building up this 4,000-acre ranch in Wyoming where he's going to be growing hydroponic algae to create shoes out of. And I'm not kidding. I'm not at all kidding. You probably, this is the thing that a lot of people haven't heard of. But this is the kind of thing that catches my eye. I don't know, man. That's a way to work yourself into my heart. Somebody who's weird enough to go from being a rapper, a music producer, an entrepreneur, whatever, to now owning 4,000 acres in Wyoming with the idea of growing algae to make sustainable shoes with an interesting, trippy-looking, kind of solar punky design. I don't know, man. What's your take on that?
That's funny. I think that's hilarious, right? I mean, look, I'm okay with that if it's actual, like if it's real, unless it's just Kanye assuaging his own ego. But look, I'm not against coming up with technological solutions to issues that may be able to cut down on waste or cut down on the materials to which we use in our products. And if it can be this kind of biodegradable shoe that you can build in a factory that's just basically a hydroponic place, I'm not against that. I don't want them to use resources like they were doing for oil. Like they would say, okay, we're going to use corn for oil, ethanol. And it's like, well, wait, that's not getting your bang for your buck. And we need those crops to eat. We don't necessarily need that to, but if he's doing this and that not taking it away from anything else, have at it. It's his cash. If that makes the world a better place, go for it. And with this Kanye, he may have a megaphone in order to put that out there. The funny part is, though, what I've heard were liberals angry and annoyed because they thought Kanye West was going to somehow undermine the black vote for Joe Biden. And this has gotten all sorts of arguments online. Deborah Messing and Nina Turner got into a massive back and forth over this issue, where Nina thought Deborah was kind of stepping out of her place, saying that blacks were going to be taken from Joe Biden as if Joe Biden owned those people's votes. Yeah, this has been right much consternation around this. Yeezy sneakers. Oh, Andre has some Yeezy sneakers as we speak. Right on, right on. Our engineer.
He's saying,
we have a caller.
I'm going to relay this real quick. Andre is saying, to be honest, these are the most comfy sneakers I've ever had. That's a direct quote. But yeah, we can get to Tariq from New Orleans. Tariq, you're on the line. What is on your mind, man?
Good morning, gentlemen. I have 3 comments, but before I get to my 3 comments, you have this man named Anton Shakin. He wrote a book on autobiography of the George Bush Sr. and also the treason in the United States years ago, and they got a new book coming out. His name is Anton Shakin. He used to be with the LaRouche Pact. Okay, they had a study that came out of Texas of observation study of this doctor was using this steroid called Budesonide, and it helped out his patients with COVID-19. It basically attenuation of the ketone, which means it slowed down the ketone and helped out these people with comorbidities. And now you got European nations putting it on trials now. I put that link to y'all link for today under y'all tweet for today. My second comment is the CDC had posted something years ago about the safety of hydroxychloroquine dealing with malaria, and they say something about it can be used by all ages, nursing women and pregnant women as well. And I posted it up too. And my third comment is dealing with the WHO was speaking yesterday, I think 2 days ago, dealing with the airborne thing, dealing with the 239 scientists talking about it might be airborne, and they brought up hydroxychloroquine in a study that Lexit had put out there, dealing with hydroxychloroquine and how they stopped the test trials. But what they failed to mention is that Lexit had retracted this study because they found out that it was shady, and the WHO didn't even mention that. They didn't even start up their trials back on hydroxychloroquine, which was odd. That everybody knows that, the Lancet, not the Lancet, but that article what Lancet had put out there from that group that supposedly did that study was basically a fraud, and the WHO did not update their data on what they know about hydroxychloroquine coming from that Lancet study. That's all I wanted to say this morning.
Thank you, Tarif. Yeah, thank you for the call. That is, with the hydroxychloroquine, that is a good point. As you mentioned, there was a Lancet study that was published and then retracted. It was based on debunked data. The database of data was basically it was wrong. And then they retracted it, and so that caused a brief wave in the media. But like so many things, that wave wasn't big enough to counter the earlier wave based on that study that had, quote unquote, debunked hydroxychloroquine. It's interesting to hear that this. You're saying, are you still on the line, Tarif? Oh no, he dropped. Okay, cool. Yeah, the 239 scientists who published that letter. We were talking about that this morning in headlines just a couple minutes ago. Are you saying that that the people who wrote the letter mentioned hydroxychloroquine, or that the WHO? Can you just say that again, please?
No, okay. It wasn't 239 scientists. They didn't mention that. It was a reporter who mentioned the airborne. About the 239 scientists talking about the airborne.
Yep.
And in the same sentence, that person also mentioned about hydroxychloroquine.
I see.
I think they would be referred. Yeah.
Okay, that's interesting. Thank you. Yeah, I was trying to figure out whether the scientists who'd published that letter had mentioned hydroxychloroquine, because that would just mean some things. But bias in either direction potentially. But it's interesting to see the WHO not sort of walking back that they should have done. Another thing I'll briefly note, with the hydroxychloroquine thing, something people have been talking about for a while is the profit motive. Again, people have been putting hydroxychloroquine up against remdesivir. They're not exactly comparable drugs, but of course people are looking to both of them as potential ways to reduce the severity of the course of this disease as people get it. And a lot of what people were talking about was how profitable remdesivir is. It's apparently, again, owned by Gilead. They would make quite a bit more money. And again, as we saw recently, apparently the United States bought up the world stock of remdesivir, doing who knows what to the stock prices there, and the long-term profitability of that company. So there are these questions about profitability and how that's impacting choices that politicians are making when it comes to this stuff. I don't know, man. What are some of the earlier treatments we were talking about, like blood transfusions? We were talking about plasma transfusions from people who had basically survived the disease and had developed the antibodies. That was an early thing. More recently, there was word on a steroid drug, dexamethasone, that might be beneficial. And it seems in the past couple of weeks, after we got that dexamethasone thing, I've seen a couple of other new medications come out too, people bringing them up sort of out of the woodwork or something like this. But this stuff is all, we were talking about this off show the other day, stuff is all so muddled. The information atmosphere is polluted. There's so many words, so many layers of things, and this often happens with news, especially with this big of a story. You get waves of publications, waves of reports that are often wrong, and then they're corrected, but the correction doesn't make as much traction as the initial story did. And so you're sort of archaeologically trying to dig through this stuff, and it gets complicated, especially for somebody who doesn't have any particular background in medical health or virology. or that kind of thing. Anyway, that's my take on that.
No, you're right. I mean, if one of the things you're always stuck with if you're coming into a new subject is who's right. Because you're all, within the context of the subject, oftentimes you get debate on a host of issues. And so that's not, I'm not necessarily shocked that this is any different. Also, science is one of those things that expands and grows its knowledge just based on testing and observation. There are times where there's a political bend to the science, but I think most scientists basically are head down, doing their job, and just trying to come up with solutions to various problems. And what we're seeing is basically the sausage being made. So these guys come out, they take a hypothesis, they have a study, they come out and say, all right, this is what works. Then somebody else comes out with another study, says, okay, this doesn't work. It's falsifiability. It's not, this is not a pronunciation from God. Every time these guys come out with a study, these things are up to be falsified if new evidence or new information comes out that challenges the veracity of the official study. That's science. It's a tool. That's part and parcel to the tool. It's like the ball peen of a hammer. It's there for that reason. That's not a bug. That's a feature. Now, the catch here is in the COVID-19 thing, we're watching this take place in real time. So it's not like there's a proclamation of something that happens 40 years and we're just using the information from what happened 40 years ago. We are in the process where they are literally doing research. They're trying to figure out therapeutics all at once. And the public, who has a certain degree of wringing their hands about this stuff because many of them are stuck in the house or stuck in various places and have to wear masks. Oh, how bad, how onerous. But are stuck wearing masks or whatever. Well, they look at this and they think, I want to get back to my life. And the scientists are like, well, we need to come up with solutions in order to ensure that you going back to your life is going to be safe for the rest of the community. So it's like this kind of contradiction between we want this, childish and ego-filled, as opposed to, well, look, reality says this is what works. And that may change over time. And so I get the annoyance associated with that. I just kind of look at that as sausage making. That's just kind of part of the process of these guys trying to discern what's going on. So I do think that would probably change. I mean, hydrochloroquine may inevitably end up potentially working either for this strain or another strain. But I have to be honest, I am less concerned about what drug or what treatment works, because those are factors of science. Those are not factors for prognostication of people like me. Even if I have some kind of thing within the medical career, then I could talk about it sensibly, fair enough. But these aren't opinion things. These are things that are just either validated or not validated through the scientific method and scientific process. And the very act that Trump is saying this stuff, or the very act that he has Peter DeVaro going out here touting this stuff, turns something that should be a medical issue and a health issue and a scientific issue into a political one. And I think in and of itself, that's problematic. What do you think, Shane?
I think there's a few layers, and I'm gonna have to wrap this one up. I kind of wanted to talk about the Kanye, the Yeezy thing, but there was one more comment. But you know what? We should probably we can come back to it. We're also going to be continuing this conversation with Dr. Mikhail Kogan. My very brief take is science, like the scientific method as this process. Scientists are not inviolable. Their reasoning is not inviolable. What we should look up to is this sort of purity of the thought process that scientists ideally are engaging in. The problem with the way that this whole crisis has gone has been that, as far as I can tell, at least the public faces of these ostensibly scientific bodies have bungled it so constantly, so often. There's been a lack of coordination between the different, departments, whether it's nationally, internationally, whatever, where people are giving different reports of what's actually going on. That's not science, but it's our interface with science. And therefore, I think we have a lot of reason to distrust what we're hearing from quote unquote scientists on this stuff. But having said that, where else are we going to turn? These are the people who should be, and in some deep level, hopefully are, giving us the closest image of the truth they can. It's just, again, it's this political process. There are arguments about status quo and rent seeking in the scientific community and how that suppresses new findings, all this stuff. And obviously, again, these are not just scientific bodies, they're political bodies. They're sitting at the intersection of those two sort of spheres of engagement, so that they're going to have to deal with the problems that arise. But anyway, we'll carry this conversation forward. We'll pick it up. We'll talk about the state of things as they are in this next segment where we're talking with Dr. Mikhail Kogan about COVID-19. We'll be back in just a minute. You're listening to Fault Lines with Thomas and Stranahan. Be right back.
Fault lines.
You're listening to Radio Sputnik.
Tune in to Loud and Clear with Brian Becker for the latest news, commentary, and political analysis. What's really behind the political and social crisis gripping the United States and the world? If you're tired of a superficial and shallow reporting for the mainstream media, here's your alternative. Forget the spoon-fed sound bites from pundits who know so little about so much. We deal with real issues. War in the Middle East, the military-industrial complex, U.S.-Russian relations, the rise of China, austerity, mass migration, global warming, and social justice movements in the United States and around the world, and much more. We bring you independent experts, analysts, and activists. Learn what really makes the decision makers take from the boardroom of Wall Street to the West Wing of the White House. Here is where the people fighting for chance speak and are heard loud and clear 5 days a week on Radio Sputnik and SputnikNews.com.
Fault lines.
Welcome back to Fault Lines with Thomas and Stranahan. We are joined now by Dr. Mikhail Kogan. Very happy to have him back on this week. He is the medical director of the George Washington Center for Integrative Medicine, assistant professor of medicine at George Washington University, and the founder and executive director of the AIM Health Institute, a Washington, D.C.-based nonprofit delivering integrative services to the underserved. Dr. Kogan, thank you for joining us. How are you doing this morning?
I'm pretty good. Pretty happy to be here again.
Thank you so much for joining us. So you might have heard, we were just finishing up a conversation about the scientific community, the degree of trust that we should place in these administrative bodies that sort of exist at the intersection of science and politics, like the World Health Organization or the CDC, or even public figures like Dr. Fauci or the Surgeon General. Could you just, I guess you didn't hear the last of that last conversation, but there are all these questions, and they're pressing because we as people who exist in this public, who exist outside of these institutions and are having to depend on their guidance, it's pressing in that sense, but it's also so removed from practically everything that we know, the details of virology, how the novel coronavirus interacts with our cells. This stuff is way beyond practically all of us, including myself, and I'm sure Jamarl too. So can you give us sort of any guidance? What's your take on that issue? And from the perspective of somebody working within the medical system, what do you see going wrong? What do you see going right? What should we know about this whole system?
Well, I actually was listening to the last couple of minutes of your prior segment, and I completely agree with the statement that, scientific inquiry takes years and often decades to come to a careful truth. And the reality is when you have tons of data coming up in a real time in not just weeks, months, but days and sometimes even hours. And, we see in real life contradictions between different studies, different information. And it's very easy to grab on and blame somebody when they're just trying to do their best and synthesize the information that's coming their way. And I think the public is so divided, and the reality in the scientific inquiry, it's almost always that you can find studies contradicting each other on pretty much, I would say, almost every subject. And it takes not just time, but also a consensus to come up with sort of the best available evidence and then use that. And so we really can have that consensus quickly enough here. And so I think despite the fact that we're trying to do our best, it's hard to find a balance and say, this is the most reliable information. And so what obviously government officials are trying to do is they're trying to indeed do that. And the fact that there could be mistakes made simply because of that data that those decisions are based on could be faulty. We talked about this last week, right? Even myself was giving the wrong information on your radio some weeks prior to the last week, right? Remember, we talked about the hydroxychloroquine study that was published in England, claimed increase in mortality that was pooled a couple of weeks after it was published in one of the top journals in the world called Lancet, just because it turned out that the data was wrong. And despite that, we all used that data because we thought it was it is a very reliable journal. It just so happened there was a mistake. And, it causes not just an uproar continuously, but it causes the sense of, can we trust anybody? And I think we can. I think we can and we should. And, we could verify what we're trying to read, but at the same time, you're absolutely right. We can't dissect a lot of the information ourselves. It requires not just advanced degrees, but the teams of experts to try to cipher through all kinds of information to come up with a picture that's, close to truth. And can we blame anybody for mistakes? I don't, I think that's the question that we can argue back and forth a lot. But in reality, I do use CDC data. I do listen to GW University experts. And, I realized after a while myself that me reading all kinds of articles coming out every couple of minutes is very counterproductive. So I decided that I would just listen to the leadership at our university and then look at CDC data and, anything else like the other set of data I'm using, which may be relevant to today's conversation, is the CMS.gov, which is a official Center for Medicare and Medicaid Services, and government websites that provide you, hopefully, with a reliable data.
I'm glad you said that, because I try to make the point to people that science is a process. It's not, proclamations by God. And any study has some degree of caveats in it because nobody is perfect in doing those studies. And you end up with a lot of studies in order to try to come up with some understanding of what reality is, to get some picture of it. But like you said, in this moment, all of that process is taking place at once and condensed in the moment, where people are seeing, okay, here's a study, here's a study, here's a study, and the study may come out with different bits of information, but in 10, 15 years, you might have a more complete picture of what's taking place. I agree with you. I don't think you can throw out science or throw out scientists just because you're watching a process that I think a lot of people don't quite understand how that process is supposed to operate. So I agree with you on that. Not to mention, if you throw out scientists, where are you going to? Which doctors, in order to get your proclamations on how things are going, however flawed they might be, it is, I would argue, the best source of information. I have to ask you a question, though. Why the resurgence? So what happened? What were the flaws that have basically caused this virus to come back roaring in the way that it's come back roaring, when at one point we thought we had it under control?
Well, I think a lot of people don't take it seriously. I think, a lot of politicians are probably taking a position of, not just taking it not seriously, but, allowing the process to just go without, implementing recommended strategies of containment. If you look at the sort of which states it's most spiking in is, states that have, over the past weeks, have pretty much maintained the least amount of precautions. And should we be surprised by that? No. I think what's surprising is, or not so surprising, but we were hopeful that the heat wave sets in, there's going to be less transmission. We were hopeful that it looked like some weeks ago, 2 or 3 weeks ago, that we were, starting flattening the curve and going down. And at least in a lot of states, New York, our own area, we've seen a continuous drop. Unfortunately, it doesn't seem that sort of for the country as a whole, that's the case. So it does appear that at least in some states, they're going to have to impose more aggressive measures if they are to slow down. And, what's saddening is not only that it's happening, but the fact that this was predictable, right? This was discussed, this was acknowledged, this was presented as a possibility, and it's lives. For each 1,000 cases illness, I mean, there is a attached mortality. Luckily, from what it appears, there are two things that different compared to, let's say, what we've seen in New York weeks ago, is that younger people get it more frequent, so 30, 40-year-olds compared to in the first wave, the massive wave, mostly, let's say New York was hit probably the hardest. The older population was affected there a lot more. It's not that it's affected less now, it's just there's more effect in the younger population. And so in the younger people, the mortality is a lot lower. So we're sort of, at least the positive angle to this is it sounds like the current mortality is lower than it used to be. Of course, it's also partially in fact that as the intensive care physicians are learning this disease and figuring out new treatments, and there are some developments, we talked about some of them last week. Also, the mortality in the facilities also improving because the treatment's getting better. So those are at least some positives in the mix.
That's good to hear. Yeah, I think if we can, maybe we can talk about the nursing homes. This next segment, we can devote that to that. I had a quick question though. Earlier this morning, actually yesterday, pardon me, World Health Organization came out. Again, we were talking about this letter. 239 scientists submitted a sort of formal complaint or a formal request, don't know how to phrase that, basically recommending that the WHO reconsider their official take on airborne transmission. Now, the WHO has recognized that aerosolized transmission coming from mechanical ventilators, the idea being you intubate somebody with a ventilator and they're sick, that ventilator is potentially going to aerosolize the virus that's in their lungs. It's going to basically dissipate it into a sort of fine spray that will then freely float in the atmosphere. Please correct me if I'm getting that wrong. But I've heard about the possibility of airborne transmission for months. This, again, please correct me if I'm wrong about this. This would be distinguished from large droplet transmission, which is more readily blocked by masks. But now there's this sort of reconsideration. Could you please fill us in on what the details are there, what's actually going on, what you've seen?
Yeah, I decided not to go and look into this in a great detail because to me, it doesn't really fit my understanding of the disease. I think that the mask appeared to be currently the most important things we can all do. This disease, even if this spread does exist, it doesn't mean that the droplet, some form of droplet transmission doesn't exist. I think both could be correct. More importantly, I feel strongly that, the until statements like this are proven, it's very difficult to change the course because what if it's not true? And then turns out that we've lacked certain restrictions and, can we do that? And this is where I feel it's a WHO responsibility to take that statement seriously and say, fine, we need to do an immediate research and to confirm or disconfirm this statement. Until that point, I don't feel comfortable following some of these publications and statements saying young people don't need to wear masks until they are in front of a sick person. To me, that this is really not consistent with current best understanding, no matter who tries to put what claims in.
Okay, we're going to take a break at this moment. We're going to be back with Dr. Mikhail Kogan, Assistant Professor of Medicine at George Washington University and the founder and Executive Director of the AIM Health Institute, a Washington, D.C. based nonprofit delivering integrative services to you, the undeserved. You're listening to Fault Lines with Thomas and Stranahan. Stay with us. We'll be back in a moment.
Fault Lines.
Epidemics and pandemics could kill millions of people, and they actually did. Centuries ago, deadly outbreaks called the Black Death, the Plague of Justinian, and the Spanish flu ravaged countries, empires, and whole continents. Some of these diseases are still present around the globe. Others have become a thing of the past. Discover how these ancient and not-so-distant outbreaks from previous centuries differ from modern-day SARS, MERS, and coronavirus pandemics. Listen to our new series, Outbreak, the deadliest epidemics in human history, this week on Radio Sputnik.
Fault Lines.
And we're back. You're listening to Fault Lines with Thomas and Stranahan. Again, we're joined this segment by Dr. Mikhail Kogan. He is the medical director of the George Washington Center for Integrative Medicine. We were just having a conversation about coronavirus, scientific institutions, medical bodies, who you should trust, droplet transmission, all these different things. We're going to turn now slightly, also looking at the coronavirus, to the conversation about long care facilities and nursing homes. It seems like, again, we were just talking about this. Early on, New York, a lot of the early cases, a lot of the early mortalities were coming from these nursing homes. Could you please give us some background? Why did that happen? Is what I just said true for one thing? And if so, why do you think that happened? And what's changed since then?
Wait, let me interrupt that for 1 second. Just to put a little data on that, 42% of all of the cases came from 0.1% of the areas, meaning nursing homes. So I just wanted to add that stat to it. Please continue to answer, Dr. Kogan.
Right. And it's currently the sort of what we know in terms of overall data set in nursing homes is that, we have nearly 120,000 confirmed cases. There's over 70,000 suspected cases, and there's 33,000 deaths. And so if you kind of think of that, and if you say, look, if you combine confirmed and suspected cases, that's over 200,000 with a mortality rate of over 15%. That's a pretty striking and terrible number, especially considering that if you kind of go back into details of this report that data.cms.gov has on their website, pretty much almost every state is affected, and some states have it a lot more. And why this happened first, it's quite obvious in a way. Think of last time you visited a nursing home. It's a confined environment. Most of these facilities do not have ventilation at the level of needed for the isolation rooms, meaning that if the person in room A had a cough, the person in the other opposite corridor very well could get it just because the air is circulating in such a way that there is no continuous preset filtration, like isolation room, airplanes, and some other locations where this was thought through. It's just by the design. Nobody over the years have ever thought that something like this can occur, and so nobody tried to create the facilities to adjust to that. Number one. Number two, of course, there's a reason why people in nursing homes are not healthy. They have comorbidities. They often have very limited functional status and most likely pretty poor immune systems. So they're a lot more likely to get sick severely if they do get sick. Combination of these factors unfortunately created this kind of an early tsunami until it became obvious that this is one of the highest, if not the highest risk entities. And so there were really strict requirements that implemented, isolation, testing all the workers every week, at least in our area. I don't know if other locations have implemented different protocols, the removing the person who tested positive immediately. So, and it seems like those measures work. The sort of these numbers have been shifting in the last weeks very slowly. So I think the new infections in nursing homes are decreasing. And that's a good news. I think the other big component to all of this is kind of a sad reality that, unfortunately, the way I see it, and I'm going to speak now kind of personally, and this is my take on this, is that, as a society, we really have not created an optimal environment for our older adults, and it's not just the nursing home. I mean, I'm talking about the entire care for all of our older adults. We tend to not provide them the best recommendations in terms of maintaining health. We're kind of addressing an acute illnesses, but we don't have a system in place. There's not enough geriatricians, physicians who take care of older people who have the set understanding of how to maintain health in older adults. And unfortunately, as the result, a lot of our older adults are in suboptimal health. I can give you very, very simple pinpointed details. So I don't know if you've discussed strong link between vitamin D deficiency and increased morbidity and mortality from COVID. Did you guys talk about that at all?
No, I didn't know about that one.
Yes. Yeah, it's an extremely clear and very strong correlation. The lower vitamin D level, the higher the chances of you getting sick and the mortality. And it appears to be one of the most important predictors currently in terms of what can you do in addition to all the precautions. Like, is there something you can do with overall health? Now, what we don't know, if I take a person who has a very low vitamin D and give them a massive dose of supplemental form and try to fix it, is this going to decrease that person's risk? There are several studies that are currently trying to address that. Unfortunately, this is not very quick. It takes weeks and months to fix someone's vitamin D deficiency. And so we probably won't know the answer until maybe even next year. But the correlation is very clear. And then unfortunately, in nursing homes, you have more than 50% of entire nursing home population severely deficient in vitamin D. And, it unfortunately, in the past, a lot of attempts have been made to study this topic, and they have been, just like a lot of other things with nutrition, have been studied wrong. And that speaks to a couple of interesting factoids, which your listeners may be interested in hearing. One is, unfortunately, in this country, probably in most of the world, taking a very cheap intervention carries very little value for pharmaceutical industry to invest millions of dollars into study. And so thus, often the topics like, $5 a month supplementation with vitamin D have put on the sideways because it's not considered a high priority topic for the industry. That's the reason number one. Reason number two, there's been an attempt to kind of get around some of the obvious nutritional science and obvious logic and kind of say, why won't we use pharmaceutical thought process and bypass it? So let's give someone a massive dose of vitamin D once a month because it's a lot cheaper for us. And that didn't work very well. So we don't have a lot of good answers in this topic, but what it's really clear that we can't ignore this topic. And if you go back and you look through nutritional exercise, things like sun exposure, and you look at all this, how much that's been studied compared to medications, unfortunately, there's a huge gap. And, I've been very vocal saying to our government, this is unethical. It is unethical to invest exclusively in the pharmaceutical industry and give almost no budget compared to the pharma, to NIH and other entities to study, a very low-cost interventions, and I wouldn't even call them interventions. I mean, I would say a lifestyle nutrition. And it, unfortunately, and this is my line of work, where we see this biggest hit, the biggest discrepancies in older adults, because the more morbidities you accumulate throughout the life, the older you get, the difference between somebody who is very well nourished, very physically fit, and somebody who's not causes a whole lot bigger lead to the mortality. So somebody who's more frail than the person, if I take 30-year-olds, it's probably not much of a difference. I mean, they were both 30-year-olds going to make for the next 10 years. But if I try to put those difference in the 75-year-old, the person who's frail is not going to make it to 85, and that becomes very obvious. And that's where, unfortunately, we're not seeing enough, I would not even say scientific interest. I think there is enough of us in this medical field who are very interested in this. I would say I think the problem is there's simply not enough political interest and industry interest to say this is important, because finding a silver bullet, which will make a lot of money, is more financially and politically exciting and interesting. Yeah.
Dr. Kogan, let me ask you this. With all of the infections, like we've been seeing like 50,000 infections a day over the course of like the last week or so, even in nursing homes, why haven't we seen the deaths? I mean, because basically there's an expectation that within 2 weeks or so of a massive number of infections, that a percentage of those invariably die or come to expire. But we haven't necessarily seen those death numbers spike to over 1,000 like they were beforehand, even though we're seeing the cases spike to where they were beforehand. What are the new treatments, or for that matter, the new procedures that are in place that try to mitigate this?
Well, let's first try to answer why. I mean, first of all, there's a lead time. There's a lag in time. So it's not, and as the intensivists and the hospitalists are getting better in managing this, I think we're going to see a little bit delayed. So, before it was probably 2 to 3 weeks from the moment somebody was getting sick that the mortality was the highest. It's not really quickly. This disease evolves slowly and kills people slowly, or slower than, something like sepsis, for example. And, so we haven't seen that yet. It's going to be another week or two. That's one. But two, I do think the treatment's improving. And so that's probably also dropping the mortality, overall mortality, from where it was some weeks ago. You've all heard about dexamethasone, which is a steroid cutting down on mortality. I think a lot of patients are now being treated with that. There's a much better understanding how clotting, which is a blockage of our arteries and veins from forming of the clot inside, causes a lot of damage and increases mortality. And I think a lot of the treatments now involve anticoagulation of a sort to prevent the clots from forming or treating them when they do occur. So there's simply more supportive treatments that they may not be curing someone, but they're allowing the person to get over the initial very high risk of passing. And so managing the comorbidity and then the body sort of gets over the hump and takes care of the illness and the person recovers. So we're just getting slowly better there, even though I think, have there been any new cures? No. And I will be I'll tell you what some of the leadership at GW is saying, remdesivir, which we're always saying, oh my God, this is a cure, this is it. Well, it actually is a pretty lousy drug for this disease. It's not very effective. I mean, is it sort of effective? Yes. For some selected patients, it seems like it's working, but it isn't, it is not as effective. In fact, if you compare the data of the effectiveness of remdesivir, that is, over $3,000 versus the steroids, which are probably a few dollars a course, the steroids look a whole lot more impressive. There's no question about it. So, some of those early quote-unquote cures that we were so hopeful for have yet to, they fall in the arsenal of the treatments that seem to be supportive. And so I think once we combine several of them, it looks like we're doing better. Like, for example, everybody in early on were put on the ventilators. Well, the ventilators didn't really pan out to be all that effective, but the proning, the position of putting somebody on the belly instead of a back seems to actually be quite better than often even then using a ventilator in certain scenarios, sort of preventing to get person to the ventilator. So I think we're seeing a combination of those things. So I wouldn't be surprised if we go over 1,000 again next week. But I guess we're going to have to get together to talk about it, if it happens or not.
Thank you. Thank you for joining us, Dr. Kogan. It's very interesting to hear you talking about proning. I hadn't heard about that, and that seems like the kind of thing that, to your point earlier, maybe some of the sparkly or shiny things get out. Some of the easier to do things that aren't as profitable or aren't as interesting to the public aren't getting quite as much attention as they could be. Just very interesting to hear that. Regardless, we were just joined by Dr. Mikhail Kogan. He's the medical director of the George Washington Center for Integrative Medicine. He's an assistant professor of medicine at George Washington University, and he's the founder and executive director of the AIM Health Institute. That's AIM Health Institute, a Washington, D.C.-based nonprofit delivering integrative services to the underserved. Thank you again, Dr. Kogan. We'll be back in just a minute. For everybody listening, you're listening to Fault Lines with Thomas and Stranahan. 2 more great hours coming up.
listening to Radio Sputnik. Telling the untold.
Fault lines.
Live from the divided states of America, welcome to your daily inoculation for propaganda. In the left corner, I am the indefatigable, the ever-vigilant, the last antibody to a sick and seizing political system, your political analyst, Jamarl Thomas.
And in the independent corner, floating on a rug, I'm somehow levitating with my mind, I am Shane Stranahan, your investigative radio show host.
You are listening to Fault Lines with Thomas and Stranahan. There we are. So let's get to some headlines. In the news, after a group of 239 scientists sent a letter to the World Health Organization urging that they address airborne transmission of the coronavirus, the World Health Organization on Tuesday acknowledged evidence emerging of the airborne spread of the novel coronavirus. President Trump has also formally notified Congress and the World Health Organization that it's withdrawing from the WHO, criticizing the organization's handling of the crisis. Yeah, because Trump has done so well. Texas is reporting more than 10,000 new coronavirus infections, a single-day high, and has seen hospitalizations more than double over the past week, with 9,286 patients now hospitalized. The state also saw its highest single-day death toll yet, 60 people dying from COVID-19 or comorbidities. Dr. Anthony Fauci has said that he is strongly in favor of mandating mask use amidst a rise of COVID-19 cases in Alabama and around the nation. Meanwhile, Georgia Governor Brian Kemp has said he would not support a government mandate on wearing masks. In Brazil, President Jair Bolsonaro has said that he has tested positive for the coronavirus after suffering from a fever and muscle aches. Brazil is the second to the United States in the number of deaths attributed to COVID-19. China has opened a new national security office in Hong Kong for the very first time. Hong Kong's government has also banned children from engaging in disruptive political activities in school and has specifically banned the singing in school of the pro-democracy song Glory to Hong Kong. In Serbia, riot police have fired tear gas to disperse protesters who stormed parliament in response to the imposition of a COVID-19 curfew in Belgrade, the capital. Protesters said they were angry because the government eased restrictions to hold last month's parliamentary elections, spurring a rise in new cases. A report from Human Rights Watch said that more than 180 bodies have been found in mass graves in northern Burkina Faso. The government forces are fighting an Islamist insurgency. The group has said that the bodies appeared to be a result of extrajudicial killings by the army. A statue of former President Andrew Jackson, placed in 1822, will soon be moved from outside the City Hall in Jackson, Mississippi, a city named for the president. The City Council voted 5-1 to remove the statue, but again, to repeat, the city itself is named after the 7th president, the same president to which they're about to remove that statue. That is fascinating. Major League Soccer begins the season tonight in Florida after the organization paused for 4 months ago. The league's teams are sequestered in resorts for the duration of the tournament, which will be played without fans at ESPN's Wide World of Sports complex at Walt Disney World. Interesting. With that, you're all caught up. That is the news. You're listening to Fault Lines with Thomas and Stranahan. There we are. So one of the interesting news tidbits that I found, this was not necessarily in our news thing because it didn't necessarily meet to the mantle of news in the case of what's taking place at this very exact specific moment around the world, but it is taking place, and it is a poll. People who know me know I am fascinated by polls, not because I think they're the word of God, but more so because I think they're a snapshot, especially if they're done honestly, of what is taking place and what's in the public's consciousness. And some of the most fascinating things are contradictions or the things in the poll that go beneath just the main numbers. Now, we do have it where Joe Biden is basically leading in all of these polls. But I want to get to this question of where you get into favorability, unfavorability, and the question of whether you think Biden has the stones to do the job. So when you get into your general impression of Donald Trump, what do you think, Shane? Do you think the public, when they say what is the general impression of Donald Trump, do you think that's higher than Biden's or lower than Biden's?
Talking about stamina, just to be clear, right?
No. Before we get to stamina, I want to go through this one. Do you think that the public has a generally favorable impression of Trump?
Oh yeah,
or
probably
a more favorable impression of Biden?
Lower than. I would say that they would think that Trump is lower than Biden.
All right,
that's my guess.
Last June, 2020, Trump, very favorable, is 22. I'm sorry, Trump is 22%. That's Trump. Joe Biden's favorability, 16. 16.
Yeah, that's interesting.
I mean, that's very favorable. Yeah. Somewhat favorable for Trump goes to 16%, and somewhat favorable for Biden goes up to 28%. But from the standpoint of very favorable, Joe Biden has been 20% was his highest going back in September. And that number is only basically floated around to like 15% or whatever, but it's at 16%. That's all. He's not that favorable.
That makes sense. That breakdown makes sense to me. And this kind of fits with what we were talking about with Ted Rall a couple of weeks ago, where he's using the term Bidenism, where a lot of people are voting for Biden against Trump. And a lot of people who are voting for Trump are voting for Trump. They're not voting against Biden necessarily, although, there's an element to that. But the idea that he has a slightly more devoted core following, whereas Biden has a larger general following, I could see that, and that would match the sort of shift in the general polls of who's more likely to win the presidency, who people would vote into office in 2020. That fits with that.
Yeah, they find him to be, it's like a default of sorts. Here's the other one, stamina. Now, how confident are you that Donald Trump has the mental, physical stamina necessary to carry out the job as president? And the same question is asked for Biden. First question, who do you think had the highest numbers?
I would say Trump.
Trump did get it. So Trump has 33% very confident that he can do the job. Joe Biden, 23%. 23%. And mind you, that's in a poll where the public voted easily for Joe Biden in this poll. It's like you said, he's the default. And so the public doesn't all that much care. They just need an empty body, a warm body to put in there to get Trump out of office. And that seems to be what they're going by. After all, Joe Biden has been running from his basement. And he was like, I only want 3 debates. I only want 3 debates. Because in his head, he's winning this, and the debates are only going to potentially make him look worse. There's no upside for him. And so he limits the debates. But I think he understands, and his team understands, that people are not voting for him for an aspirational image of what he's going to do. It's entirely just give it to Trump. And there's something so sad about that, profoundly so, that at this moment where all of this stuff is on fire, and where the public is screaming for something different. Even the New York Times is like, we got to do something different. And the best that we get is Joe Biden. And Joe Biden has basically said, look, nothing is going to all that much change. That's sad. That's so sad.
Yeah, I mean, two dudes in their 70s. I don't know, man. That's again, nothing, like, legitimately nothing against older people, because they're the people who have the most wisdom on this deep level. They have the most accumulated experience of the world, and to that extent, we should be looking up to them as leaders. On the other hand, we're talking about stamina. We're talking about the qualities of fortitude that you would think you'd need to be an effective leader in an increasingly divided country. 2 70-year-old dudes. I don't know, man. I think it speaks for itself.
Massively out of sync. Like, when you look at what the public wants, the public is basically saying, we want something different. And you had an election campaign running in the primary where the public throughout the primary had basically said, we want these lefty policies, meaning the Democratic primary. Like, take out the other part for the moment, because it's a Democratic primary. It's not a Republican primary. And you had the people who basically said, yeah, Sanders, we agree with you on the policy argument, but we believe Joe Biden is more electable. And that's like, so wait, those things aren't tethered? Like, your ability and the things that you want from the standpoint of policy aren't tethered to whether or not you think the person can get elected? Like, this is the weird stuff that they were doing during the primary. And now you get to this moment where the world falls off its axis. The New York Times is screaming for Bernie Sanders without saying his name. And the best that the Democratic Party offers is Biden. And what they are willing to accept in order to give it to Trump is Biden, despite the fact that they actually made it clear that they had all of these things that they wanted. And this is a person who will not give it to him. I find that to be so disturbing, especially at this time where the arc of history is begging to be bent. One more thing. The Andrew Jackson statue. What do you think about that? That is weird, right? I mean, he's basically president. This town was named after him, and they're now removing the statue. Isn't there a logical problem there somewhere?
Well, yeah, there is. I'll throw this in too. Did you see the Washington Post published an op-ed the other day, basically recommending that Washington University reconsider its name?
Interesting.
Now think about that. The Washington Post. But I'm going to say that again. The Washington Post published an op-ed. The Washington Post. How many times do I need to say it? Published an op-ed that, I was pushing for that. I mean, on this age thing, again, I'm just going to come back to this for a second. I was just looking this up.
Go for it.
The last two successfully democratically elected presidents, successfully elected presidents from the Democratic Party, Barack Obama, Bill Clinton, they're on the list of 5 youngest people to be elected when they were elected. Yeah, Bill Clinton's the third. First is, I'll just go through this real quick. Theodore Roosevelt was 42 years. John F. Kennedy, 43 years. Bill Clinton, 46 years. Ulysses S. Grant, 46 years. Barack Obama, 47 years. So the last couple of elections, they were running relatively young dudes. Again, fairly young, up there on that list. Now it's as far as I can tell, one of the oldest people to be running for president. I don't want to put too much stock in that, but I think that does show. Again, age isn't just a number, and age shouldn't just be a number. There should be, on this topic we were talking with Dr. Mikhail Kogan about how people later in life are pushed into these nursing homes. There's this big conversation I think we should be having more. And it fits in with the conversation about school, where school is entirely age segregated. It's not segregated by interests. It's not segregated by abilities. It's not separated or whatever. Segregated as a term has obviously a fraught history, but it is segregated by age. People are separated from each other by age. And that, I think, holds throughout our society. You have people who are minutely divided as they're going through the tract school system. Then you're sort of pushed into this wider percolative sphere of work, and then towards the end of your life, you're put together with a bunch of old people again, and that whole process seems wrong. You want this diffusion of knowledge and diffusion of interests and vitality and all this stuff. You want this to be happening. You want those spheres of engagement to be colliding, because I think that that's part of what constitutes a healthy society. Another side, though, of age, that's a sort of separate, more philosophical or cultural conversation. Age is also, of course, if you have if in a profession, if the average age keeps getting higher, then that's showing you something about that profession. It's showing you something about that sphere. It's showing you that the people whose beliefs or practices or whatever were in vogue a couple of decades ago, their beliefs and practices are still in vogue, if that makes sense. It's a sort of lagging indicator. The average age of, in this case, people who are running for the presidency, it's an indicator of sort of how out of touch the body that put them into those places, how out of touch those bodies are. And I think that we really can see that with the DNC and with the RNC too. What's your take?
No, I agree. I do agree with that. I mean, look, I agree. The age is not just a number. I mean, our society has magical thinking sometimes in the way that we think about this stuff. A person gets older and their physical stamina degrades just as a result of getting older. It's not, yes, some people can do exercise and everything else, but that exercise is to hold back the night of age. Like, it's not so much that I'm attacking or anything like that. It's just somewhat of a flat fact. It is what it is what it is. As you get older, your physical stamina, unless you're doing something about it, degrades. And in both of these candidates, especially in Biden, I think it is obvious that it is degrading. But we're going to be back in a moment. So let's take a break here. You're listening to Fault Lines with Thomas and Stranahan. We'll also be taking calls when we come back.
Fault Lines. Want to talk? Get in touch with us at radio@sputniknews.com.
Shooting from the lip.
We're taking no prisoners here. Real opinions for real people. Where we bring you people with controversial views, and instead of trying to catch them out, we actually let them expand on their views. What's going on in British politics, European politics, and indeed in world politics as well. And wherever you are, whether you're a UKIP supporter, a Tory or Labour, everything is in turmoil.
John Gaunt.
Shooting from the lip.
Fault Lines.
And we are back. We're taking calls this segment. You're listening to Fault Lines with Thomas and Stranahan. And soon enough, you could not just be listening. You might also be able to talk, too. 202-521-1320, 202-521-1320. That is the number to call. Quickly going to give us a shout-out. If you want to listen to us on the radio, we're in Washington, D.C. at 105.5 FM and on 1390 AM. Meanwhile, on the flip side, in Kansas City, center of our country practically, 102.9 and 104.7 FM, as well as 1140 AM. We're also live right now on Twitter, on Periscope. If you go over to twitter.com/faultlinesradio, you can see that Periscope. Also on YouTube, Jamarl has a live feed up. If you do a quick search for his channel, Jamarl Thomas, you will find that live feed. You will get to see his face and my disembodied head. You can also check out the Fault Lines Radio channel on YouTube. Also, if you want to, we're going live, not going live, we're posting our episodes later on various audio platforms, including Spreaker, Stitcher, Spotify, iHeartMusic, and Apple Music. Pardon me, I always get this wrong. iHeartRadio. There we go. There we go. Okay. Better. All right. Again, though, we're taking calls 202-521-1320, and we have a caller. Brendan from Missouri, you're on the line. What is on your mind?
How's it going?
Hey, how's it going? All right? Yeah, we can hear you.
All right, great. Basically, this is my second time calling into JT. He wasn't on the show last time. It was the other show. It was right after the second primary contest, the Democratic primary. And I'm just, I called rigging, and basically, Bob kind of thought I was crazy and, off the get because there wasn't much evidence of that. Now, I myself felt like it was rigged even in the second primary, even though Sanders won, they just pulled votes going. But they basically said call back in after Super Tuesday. So I guess I'm doing that now, even though it's a little belated. And I'm just curious, do you guys actually believe the Democratic primary was legit, or was it just blatantly rigged? Because I have a hard time seeing it any other way than blatantly rigged. To me, it looks like on Super Tuesday, they actually just switched the names on the things, and all the Sanders votes went to Biden, all the Biden votes went to Sanders, and that's how we won. So, and then if you do feel that way, what can be done to push election transparency and get it out of the realm of conspiracy where if you talk about it, you're the crazy. All you're trying to do is, see what the actual results are. So that's what my question.
Good question. Thank you for the call, man. I appreciate it. So I do think 2016 was rigged. Flat out, I just do. I think by the time you got to Iowa, I think Iowa was clearly problematic, to put it mildly. I mean, they went so far into Iowa as to bring Pete Buttigieg and said they waited and they eked out those results over the course of like a week. And then finally on Wednesday, magically, they came down with the results and said, Pete, you won. Oh, I won, did I? It's like, yeah, that looks a little dodgy, considering everything that took place in Iowa with the vote, the companies and the intermingled relationships and all this other stuff. I mean, they fired that guy who was running the head of Iowa. I think his name is Price, for that very specific reason, because of how dodgy that was. But by the time you got to the other states, yes and no. I mean, it's hard to know, right? Because ultimately this stuff takes place in computers, and that kind of is the problem. We can't see it in a transparent way for us to know that this process was fair and earnest. And I think that's a problem regardless. So I don't necessarily put it past somebody who said that looks rigged at all. How can I say they're wrong? By the same token, how can I say they're right? And that's the problem, especially when you get into that type of stuff. Beyond that point, I do agree with you that something needs to be done in regards to transparency, clearly. Because we shouldn't be having these conversations of was it correct or was it not. It should just be flatly obvious one way or the other that, yes, the preponderance of the evidence goes to this process being perfectly, legitimately correct. The one thing I would point out, though, that Joe Biden was the default candidate. And throughout the polling, Joe Biden was considered more electable regardless of how bad he was losing. So he would look like he might be X number of points down, but the electability argument was always going to Biden, and it was always a challenge for Sanders. And so the moment that you hit South Carolina and Joe Biden popped back up and the media goes onto this, he's back. Well, after that point, the whole electability argument starts to resurge back to Biden. And they're going through states in the South. There was always going to be a challenge for Sanders if he couldn't necessarily win over the black vote or come up with an argument in order to put a knife in Joe Biden in order to let that bleed out into other people. When he couldn't do that, that was killer for him, especially with Warren basically putting a knife in him so Joe Biden can crawl over his corpse on Super Tuesday. So, whether it's fair or not, I think it had problems. And I think our electoral system, the fact that that question will come up, exposes those problems. What do you think, Shane?
I think 2016 was clearly rigged. 2020 is a lot more questionable. I probably wouldn't use that word. But I mean, again, like you're saying, a lot of people, Elizabeth Warren, stabbed him in the back, like you're saying. But that's also just politics as usual. Now, if that's politics as usual, and if we want to use the word rigged for that sometimes, I think that's a good question about what the heck is wrong with politics as usual these days.
Oh, wait. I don't think he's thinking the Elizabeth Warren thing is rigged. I think he's thinking of the voter machines. Like, because you can't see, it's opaque. Like in any notion of trying to get like a recount and everything else, you have to pay millions of dollars. It's like they make all sorts of hindrances into you discerning whether or not the election was legit or not. And it's hard to see whether it's transparent. I think he's talking about like the exit polls and stuff like that, which showed Sanders was potentially winning those races.
Yeah. So I think, again, the response there would be, I don't see it from that 2020 was rigged, but that raises valid questions about the whole electoral process, which is, again, it's part of this larger thing. It's just on the specific issue. It's whether you use that word or generally how you approach that. He ended with a good question, which is, if it was rigged, and we can sort of, looking at the system, all its problems, there are a lot of problems in all these different levels. How do you address those? That's a great question. That's the question.
Yeah.
We should find answers. We should create and find answers to that question. You know what I mean?
That's a tough one. I mean, you really do need a system where people can know, like whether that's getting rid of voting machines and having these things counted by hand, especially if it's an open hand count where the public can watch those votes being counted. So, like, whatever you need to do, because I think you shouldn't underestimate how vitally important voting is. Under normal circumstances, you may have countries or governments, and within those governments, you have people who are vying for power. And short of something like a civil war, you need some process, some capability of changing over power from one part to another part without there being either fisticuffs or people shooting each other in the streets. And so the electoral system and the voting is a way of trying to mitigate that problem of who rules and who dominates and giving some level of legitimacy and credibility to the person who won that, because ideally the public chose him. So even if the person is horrendous, you still accept it to some degree because you believe it has the credibility of choice of the masses. The moment that goes away and you have a large number of people who say that's not legit and believe it, flesh to bone, you have a problem. Because now you no longer have this thing of solving the problem of legitimacy. You actually have people who are calling themselves sovereigns and saying that they have some level of justification for ruling for whatever reason they have to do so. That's dramatically problematic. And I think we trespass on that when we allow our system to be dodgy in this sort of way, where the people can't necessarily know as a flat fact that it is indeed correct. We have Louise from Virginia. Louise, what's going on?
Yes, good morning. Yes, not just credibility of the so-called electoral system, but even being interested. I mean, it's just a horrible. It's something you don't even want to hear about, even on fault lines. Now, I have two suggestions. One is that you have on Dr. Kogan once a week, because every single word he says is gold. And my second suggestion is that for Tom Luongo, who is extremely interesting, he's really fascinating, two things need to be corrected for him. He doesn't enunciate, he talks too quickly, he doesn't articulate, so at least a third of what he says you can't understand, and his microphone system is not very good. So it's almost irritating to listen to him, and you can't understand it. And that has been going on for quite a while, and nobody seems to pick it up. You don't seem to have a self-correcting mechanism or an overseer at fault lines to catch that. You're relying on a caller in such as myself to catch it and to protest against it.
Well, no. See, here's the thing. He did. I was here. He did replace his microphone. So he had problems. It got better over time. And then we asked him to replace his microphone, and we did. But he's his own person, you know what I mean? He does his own show. To your first point about fault lines, I think you're calling in because you had a complaint about our boss, Mindia. I'll admit that put us in an uncomfortable position. We shut that down real quick. But I also gave you our email, so it's not like we're not listening.
computer. You are listening. Oh, no, I would never say that you're not listening. My gosh, no, that's not what I mean. And that was, it was a very mild complaint. It wasn't specifically about your boss. It was about a self-correcting approach. And you did replace the microphone, but you better hope it holds, because his microphone program has been going on for a long time. So how does somebody listen from the exterior, such as myself, to make sure that you're getting through to the audience? I mean, is there an outside quality control? Because there hasn't been for Tom Luongo until you got there hasn't been, and you could easily, just because he's his own person doesn't mean you can't ask him, slow down and articulate a little better.
Yeah, no, that's a good point. I'll be honest. We each have our own problems with talking too fast. I've been trying to work on that too. But I mean, we are our own entity, and he is his own entity. And I'm not going to try to, not saying I would be berating him. I'm not going to bring him on and then be like, no, slow down. We can't hear you. Especially when I feel like we can. However, you're saying that. That's not something I was thinking about. And we can do that in the future. So thank you for bringing it up. But I mean, yeah, I go back and I listen to the shows pretty frequently. Not necessarily the whole thing, but key segments. I'll go back and listen to it. Yeah, I mean, are you still there, Louise?
Yes.
Okay. I got to be honest, Louise. I think that's slightly unreasonable. Now, each of us have a way in which we communicate information. It just kind of is what it is. Those little vagaries or idiosyncrasies that make us who we are. How can I tell him, hey, welcome to the show. We need you to enunciate better because one of our guests doesn't necessarily like the way you communicate. I would guarantee you that there would be a lot of other yous who think he's communicating just fine. So that's a little dicier to do. But the mic thing is fair game.
And also, Andre, engineer Andre, trusty, valuable, skilled engineer Andre just pointed out he had this problem, but that was like half a year ago. That was 6 months ago, and we asked him to change his mic. I forget it. We might have even like recommended a mic or sent him one or something. But you're talking about self-reparative mechanisms. We're not the same entity in terms of this organismal view of organizations and culture, companies, whatever. We sort of did what we could, and it made an improvement. Andre said that since then he hasn't heard those problems. Brandon, our producer, Raheem, our producer, has said he hasn't heard those problems. I haven't heard those problems. Maybe
I haven't heard it either.
Yeah, I don't know. That might be on your end, but maybe there's something we're missing. I'm open to that.
But thank you for the call, Louise.
Third sentence was the end of the sentence. And you and Shane, you and Jamarl, of course, speak very quickly because it's radio, but you're completely understandable. Nobody loses a single word. And just because it's just one caller calling in doesn't mean it's an isolated person.
No, that's true. I'm not saying that. I'm not saying that part. I guess you're saying for the thing. Let me say it this way, Louise. What we would do, we will listen to it, and we will be more astute at trying to see if there's an issue. But I have to be honest. We've had Tom on, and I didn't necessarily hear any problems with Tom. But we'll be aware. Let's say it that way. But we are listening. I mean, we're having a conversation right now. Like you said, the Minia one was a little slightly off-putting because we had just started the show and it was like, hey, we want to talk to your boss. It's like, whoa.
Exactly. Wait, that's pretty sudden.
Yeah, right. That's right. That's pretty abrupt. That's pretty aggressive. But all things being equal, no, we appreciate these calls, honestly. For all of the people who call in, you guys help make the show what it is in real terms. The callers, the interactions, the people who are on either YouTube or the leaving comments. You guys help us make Fault Lines what Fault Lines is. So we absolutely appreciate your commentary.
Straight up, too. I mean, the fact that you're calling and saying those things shows that you care enough about the show to give us that criticism.
Right.
So thank you straight up, both for coming from that place and for giving us what you do from that place. Please always feel free to call back in, Louise. Don't want to shut you down. Happy to have this conversation, too. Happy to have any conversation, practically. We're just those kinds of dudes. But regardless, I think we're going to go into a break now. We've got Guy McPherson coming on next. He's going to be talking with us about the climate, specifically this sort of apocalyptic view. I'm going to be very curious, intimidated. I'm probably going to push back in some places, but it should be a fun conversation. Regardless, though, we'll be back with Guy McPherson in just a minute. You're listening to Fault Lines with Thomas and Stranahan.
Fault Lines. We are above all the latest developments, and we don't take any sides. Radio Sputnik, telling the untold.
Tune in every Wednesday to Loud and Clear with Brian Becker and John Kiriakou for a regular segment called Beyond Nuclear, where Brian and John discuss nuclear issues, including weapons, energy, waste, and the future of nuclear technology in the United States, with Kevin Camps, the radioactive waste watchdog at the organization Beyond Nuclear. Listen on Wednesdays right here on Radio Sputnik.
Fault Lines.
Welcome back to Fault Lines. My name is Jamarl Thomas. I am joined by my disembodied co-host, Shane Stranahan. We're coming to you live from our station out of D.C. If you guys live in the area, you can catch us on radio at 105.5 FM and 1390 AM. We are also kicking it in Kansas City at 102.9 FM and 104.7 FM. Also, if you guys are really digging this content that Shane and I are putting down, whatever platform you're consuming us on, give us a like, give us a share. Also, join in on the conversation by sending us a chat, a tweet, and of course, a phone call at 202-521-1320. That is 202-521-1320. But now, coming to us, one of my favorite guests. I call him the most terrifying man on the planet, but he has an affable attitude to go along with that terror. Guy McPherson. He is an internationally recognized speaker, award-winning scientist, and world's leading authority on abrupt climate change leading to near-term human extinction. He's professor emeritus at the University of Arizona with works published for more than a dozen books and hundreds of scholarly articles. Guy, welcome to the show.
Thank you, Jamarl. It's a pleasure to be with you today.
Absolutely. So we've been discussing or trying to get into these conversations basically on climate change. And you are my foremost expert on that particular issue because people who considered your proclamations extreme have found themselves in this kind of weird, precarious spot, perched at the edge of the world, seeing that world go to pot in a similar way to which you have been describing in your writings. So can you give us just a brief take, just for people who don't necessarily know who you are or not up to date with your research? What is the thesis? What is the main summary of the work regarding climate change that's out of control or runaway climate change?
Right. Great question. I'm a conservation biologist, and like other conservation biologists, I primarily focus on habitat. Habitat for other animals, habitat for plants, habitat for human animals. And it appears to me that because we are in the midst of abrupt and irreversible climate change, and that was the title of one of my recent peer-reviewed articles, Earth is in the midst of abrupt irreversible climate change. Because we're there, it appears to me that we are going to lose habitat for our favorite species in the not-too-distant future. And I suspect that has already been triggered by COVID-19. Because of the shutdowns and slowdowns in industrial activity, I suspect that sometime around this fall, maybe next fall, we will experience profound crop failure sufficient to cause the collapse of civilization, what we call civilization. And therefore, because of the warming that occurs after that, there won't be any habitat for humans. This is not what I want to have happen, obviously. I'm rather enjoying my life, but I don't see any way around it at this point.
Basically, that's fascinating. So let me ask this one. How does COVID-19 do that? I mean, because before COVID-19 hit, would you have made that argument or made that case, or COVID-19 is creating a new reality in which this becomes more apt, more real?
I actually made this case about 13 years ago on my blog, in the third post on my blog, which was in late August, as I recall, nearly 13 years ago. And I indicated that we were headed for a world with a lot more widespread disease. One of the consequences of widespread disease, such as COVID-19, is the reduction in industrial activity around the planet. And we saw this first in China, especially around Wuhan, where the outbreak was first reported. A lot of people were staying indoors. A lot of people weren't going to work anymore. And as a result, there was this huge clearing of the air in a pretty large region around Wuhan. Next was India, where the same phenomenon was observed. Then it took place in a large area throughout Eurasia and most recently in the northeastern United States. When people don't go to work, don't go to the factories, industrial activity is alleviated, it's reduced, and so these aerosols associated with industrial activity that are produced by civilization, the same as greenhouse gases are produced by civilization. Well, when civilization slows or stops in an area, those aerosols fall out of the sky. They've been serving as something of an umbrella to keep the sunlight from ever striking Earth. So, interestingly enough, we're in this paradox that if we maintain industrial activity, we keep cranking the greenhouse gases into the atmosphere. We all know that has negative consequences for warming the planet. But at the same time, if we slow industrial activity, we lose a lot of those aerosols that have been protecting the cool nature of the planet. We're already at the highest temperature ever experienced by human beings on Earth, where we have passed the 2-degree Celsius baseline temperature above the 1750 baseline. So there's a lot going on. A recent paper in Science Advances by Raymond and colleagues indicates that we're already experiencing wet bulb temperatures at various places around the globe. This from May 8th, 2020, wet bulb temperatures that are lethal to human beings. And they point out in their article in Science Advances that this was not expected for another 80 years, because of course we don't expect anything to go wrong until 2100. That's what the IPCC has been telling us all this time, right? But as it turns out, by warming the planet at such a rapid rate over the course of the last 270 years, we're producing consequences. And we live in the age of consequences. We're there.
Well, I'm trying to get specifically though to how the COVID connection, because I acknowledge. Okay, just to give people a slight bit of background, and tell me if I'm wrong on this, but I do want to get to the COVID connection. Basically, the argument is the things that we put into the atmosphere have two consequences that contradict one another. One has to do with a global warming effect. That's the effect that most people talk about, where you have a warming of the world based on the blanket that's created by the particles that we put in, either methane, carbon, or whatever, just greenhouse gases that we put in that blocks or it traps in heat to the country or to the world. On top of that, those gases also create a global dimming effect, which lowers the temperature. And if we get rid of those items that lower the temperature, we're going to see a spike, a remarkable increase in a short period of time. I want to make sure I said that correctly, but on top of that, how does that directly relate to COVID-19 and the spike in COVID-19 cases in regards to us seeing a pandemic?
Right. So one minor change there. It's not it's the soot and aerosol particles that are cooling the planet, not gases. But that's a minor issue. Okay. So at the same time, and this comes especially from burning, quote, low-quality coal. The so-called clean coal actually has less of these particulates, less of these aerosols than, quote, regular coal does. So what's the connection to COVID-19? COVID-19 slowed industrial activity. Starting in Wuhan, people weren't going to work anymore. If they aren't going to work, they aren't cranking up the factories. They aren't cranking up the factories to produce cars or license plates or headlights or whatever it is they're producing. That causes a reduction in industrial activity. As a result, they're burning a lot less coal. When you and I stay at home, we use relatively little energy to carry out our daily lives. So we go to the grocery store once every week or two. We burn a little carbon in the process of doing so. We stay at home, even running the air conditioner, whatever. That produces relatively few of these aerosols that go up and cool the planet. But big time industry, think of what used to be the Iron Belt in a large area in the northeastern United States. Think of what is now China, where they use coal to produce all these smartphones and car parts and refrigerators and every conceivable thing. Well, if the demand for all those things is down because nobody's going to work, nobody has any money, so they can't afford to buy things, what's the result? One result is very clear skies. beautifully clear skies that have been reported in places like China and India and Italy, throughout Eurasia. But those clear skies have a cost. They are not blocking the incoming sunlight. That's what COVID-19 does, is it causes a lot of people to stay at home because they're sick or because the factory is closed. We have these relatively large-scale shutdowns where for a while, basically nothing was open except grocery stores and pharmacies. And in Belize, where I lived for about 2.5 years, they shut down everything, and everything is still shut down. Nobody's going anywhere. You can't even go to the grocery store, to the pharmacy, nothing. If you aren't growing your own food, you're starving. So the link to COVID-19 is the same as the link to any other pandemic or large-scale disease or any other activity that causes a reduction in industry. So if we reduce the amount of industry, we reduce the amount of coal burned, primarily, all those other other fossil fuels are involved as well. But mostly it's about coal being burned to produce energy. And if we reduce the amount of coal burned, we get the clean skies we have seen in places like China and India, and even the United States. And again, those clear skies, as a result of the aerosols having dropped out of the atmosphere, may seem like really good news, and they're beautiful in the beginning. I mean, people are seeing mountains they have never seen before, literally, from cities. But bear in mind that comes at a cost, and the cost is an increased amount of radiation of sunlight striking the Earth, therefore warming the Earth very rapidly.
Scott,
does that make sense?
Yeah, absolutely. Yeah. Guy, this is Shane here. Yeah, great to meet you. Great to have you on the show. I had a quick question, actually. We're talking about these issues. There are, as far as I can tell, a lot of people are worried about the climate. You seem, though, particularly pronounced in your level of confidence about the destruction of the human habitat. What do you think you see that other people don't?
I'm a conservation biologist, so I think I understand habitat much better than other people. The three pillars on which conservation biology is built are habitat, extinction, and speciation. Speciation is when a new species comes into existence and describes the forebearers for those species. Extinction is when the last individual of a species dies, and habitat is almost always the cause for the death of that last individual of a species and for the entire species. Once you lose habitat, you're done. And we are losing habitat for Homo sapiens around the globe as a result of increased heat, increased humidity. We've long known that a warmer planet is a wetter planet. And we're starting to now observe the kinds of consequences that have been forecast for a long time by people who have been studying greenhouse gases and their impacts on Earth.
All right, that is the voice of Guy McPherson. Another quick question, actually. As a conservation biologist, I'm curious, are you familiar with Alan Savory, the sort of rancher dude working on reversing desertification? Have you heard of this guy?
Oh, yes, absolutely. In fact, my early research in graduate school was dedicated to pointing out the nonsense he was producing.
Interesting. Okay, we can come back on that. Very glad to carry up that conversation on the other side. You were listening to Guy McPherson. He's an internationally recognized speaker, award-winning scientist, and the world's leading authority on abrupt climate change leading to near-term human extinction. We will be back in just a minute. You're listening to Fault Lines with Thomas and Stranahan.
Fault Lines.
Peer into the future with Political Misfits on Thursdays when we analyze the latest trends in news, politics, and culture. Catch us on 105.5 in Washington, D.C., or 102.9 or 104.7 in Kansas City. Achtung, baby.
Stuck in traffic? No problem. Stay informed. Stay tuned to Radio Sputnik on 105.5 FM or 1390 AM in the Washington, D.C. area. Need more? Follow us on Facebook or check us out on SputnikNews.com.
Fault Lines.
And we are back again. You're listening to Fault Lines with Thomas and Stranahan. We're about to get into a very interesting conversation, as we've been doing so often so far, with Guy McPherson, internationally recognized speaker, award-winning scientist, and the world's leading authority on abrupt climate change leading to near-term human extinction. I will also quickly direct people, if you want to follow Guy on Twitter, you can. It's at Guy, Guy _MCFHERSON. You can also check out his writing, his other work, at GuyMcPherson.com, spelled the same way, no underscore, nothing funny in that, just GuyMCPHERSON.com. Again, we're talking with Guy. Guy, we're talking about Alan Savory there. I've been interested in this guy's work for a while. What do you think he gets so wrong? And briefly, maybe we can just set up, if you would, what his take is and where you see it going so wildly wrong.
Yeah, his take and much of what he says is actually correct. His take is that if we run a bunch of livestock in relatively small areas instead of spreading them out in very large areas. Think of the American West when it was first settled by white people. We put livestock over thousands of acres, rounded them up after a year or two. It was very low-intensity livestock grazing. What Savory proposes is high-intensity livestock grazing in much smaller pastures. What that does is it allows the rancher to get to know the livestock individually. So they know this steer, and they know this heifer, and they know this cow, and they know this bull. And so they pay closer attention to what's going on with those animals. They can detect when something is going wrong with the animals, when they have a disease or something like that. Okay, so that's the easy part. The part that most people don't understand is, one, introducing livestock into North America was never a good idea. There is no analog for anything resembling livestock in North America. As a consequence, many, many species have gone extinct because here's this new keystone dominant species that is rapidly changing the habitat for thousands of other species, destroying habitat for thousands of other species, and as a consequence, those species are going extinct. Second point, Savory believes that by having a bunch of cattle out there churning the earth, this will improve infiltration and subsequent percolation of precipitation into the soil. That's been disproven repeatedly by range scientists and field ecologists. It doesn't make any sense, in fact, from the physics point of view, from a soil physics point of view. If you churn up the soil, what that does is make for smaller particles of soil, and they block infiltration and percolation pathways for the precipitation. So instead of improving soil water plant dynamics, what livestock are doing is destroying soil plant water dynamics and creating deserts in what used to be well-functioning, what we would call healthy grasslands. And so those are the major problems, are that he fails to recognize the physical changes on the soil and the consequent changes for the plant-soil-water relationships. And as a result, the impact is very frequently, in fact, almost always negative. And he also fails to acknowledge that introducing a new species, especially a big organism like livestock, into a habitat is not always a good idea. It doesn't have the desired consequences. And these things have been pointed out basically since he started with the idea in the late 1970s, introducing livestock into North America. And he was basically run out of Africa for his constant promoting of ideas that were not working there.
Very interesting. Yeah, a lot more we could talk about there, I'm sure. And I would push back in certain ways. I grant, however, that you sort of just by default would know more about this than I do. So I want to just thank you for sort of registering your opinion there. We can come back to that later, maybe if we get you back on, but I don't want to hog the conversation too much with that topic. I do want to turn slightly. What is your take on using iron fertilization of phytoplankton for carbon sequestration? Basically, the idea is you'd take tankers of iron out into the ocean. It finally sort of finely minced is another way to look at it, where you'd have lots of little tiny particles of iron. Then you would drop those in the ocean. That would be this sort of missing bottleneck in the development of phytoplankton, a bunch of phytoplankton would be born, it would grow, and then you would do this in a part of the ocean where there would be a downdraft that carries those phytoplankton to the bottom of the ocean, effectively capturing carbon. What is your take on that idea?
It sounds great, and it's a classic example of, in theory, there's no difference between theory and practice, but in practice there is. This was actually attempted by a rogue scientist. One, it violates international law. So this rogue scientist in, I believe, southwestern Canada tried this experiment, and it failed. In fact, it produced the opposite of the expected response. So this is the problem when we try to mess with systems that we don't fully understand. And I think this is a classic example of somebody going out and trying to mess with a system. We expect a certain outcome. Let's do relatively small scale, and this is many years ago. We could have performed small scale experiments and then ratcheted those up to medium scale experiments. We didn't have to go right to the ocean right away. So, the Hippocratic Oath, first do no harm. Apparently that doesn't apply to some scientists. Yeah, and clearly
is it an issue of desperation? Oh, I'm sorry. Please finish. I'm sorry.
No. Absolutely, it's a matter of desperation.
Well, but
yeah.
So
is there any science that has up to this point been, let's say, a beneficial thought and trying to get out of this quagmire between not doing anything in industrial activity, going down rapidly rising the temperature, versus just kind of sitting here and just kind of accepting it all?
One, acceptance is a gift. And two, and perhaps more importantly, I'm working with a scientist at the Roland Institute out of Harvard. And his idea is called MEERS reflection, MEERS, reflection. And it focuses on creating mirrors that will reflect back the incoming sunlight to counter effect the result of the loss of aerosols. So if we're getting an increased heating, and apparently we are as a result of the loss of the aerosol masking effect, then one thing we can do, the simple thing we can do, is use a set of mirrors to reflect that sunlight back out into space. So this is an idea that has been in development in the laboratory for about a year. I've been working with Dr. Ye Tao at the Roland Institute, and I think it's the best thing, the best shot we have, and it's been tried at the small scale in the laboratory and at the medium scale in the Bay, but there's not enough money to run this thing. He's got about 15 undergraduate students who are volunteering their work this summer on this project. If we could pour a bunch of money and get a bunch of interest in the MEERS reflection project being conducted by Dr. Ye Tao, I think we would at least be pursuing the best case alternative at this point. Desperate times call for desperate measures. We're certainly there. And I see no downside to employing MEERS. It might not work. It might be too late. It wouldn't surprise me at all. But I think it's the best shot we have at this point, and that's why I'm working with him on that project.
Well, so here's one of the things that's sort of troubling and confusing about this whole thing to me. Isn't that itself a sort of desperate, isn't that a big change in the atmosphere if you're going to try this, even though it's going to be implemented on a local scale? You're not going to see the wider effects as the world reaches whatever level of homeostasis it does in response to that small change. Like if we were to implement that, you were to see some local gains, and then you were to implement that more widely. Isn't that, to the point you were making earlier about the iron fertilization, just another sort of unknown foray into this area that could have dramatically varying consequences depending on how it goes?
It could be. The difference here is that this is not one rogue scientist going out and conducting, quote, research at a large scale without doing the smaller scale and intermediate steps. Dr. Tao is an excellent engineer. He's actually thought ahead and is implementing the smaller scale experimentation that needs to be done. I think we need to get a bunch more people on board with this idea and start putting some money into it. I'm not saying it will work, but If it doesn't, I think we are going to lose habitat even faster for human beings. And I'm not a big fan of that happening. So, yes, it's a classic catch-22. Is there a way out? This is what I think might be a way out. I'm not saying it is a way out. And so I think as a result, it's worth a try. That's all. I think it's worth a try. I think it's worth getting a bunch of scientists on board and having the conversation.
With all of the lack of an industrial activity during the COVID-19 thing from around the world, you made the point that you were able to, basically people could see, outside their window. It was like, whoa, there's a mountain there. There's a building there that I never knew was there because of the smog that was in the atmosphere. Have you been able, or have people been recording a substantial temperature increase that would not necessarily be here otherwise were it not for the lack of industrial activity over the recent weeks?
Yes, they have. And a recent paper indicates there are 15,000 weather stations in the United States that have indicated warmer and wetter temperatures, warmer and wetter conditions than, quote, normal or than expected. And that paper just came out yesterday. I don't have it right offhand with me, but I can send it to you so you can include in the show notes if you would like.
Absolutely. That's fascinating. Because all of this stuff, to some degree, are hypotheses. And hypotheses have to basically line up to real-world phenomena. Otherwise, it's just a guess. And so I appreciate you sending me that. I mean, because I think that's a big deal. It goes to this thing of validating your hypothesis in regards to aerosols being in the sky cutting down the temperature and the greenhouse raising the temperature and these kinds of things going tandem with one another. Guy, we're going to have to leave, but where can people find more of your work?
Thank you. And I should point out that data set is from the United States, where we've been collecting weather data for a very long time. So we have 15,000 weather stations we can tap into. That's not the case in more slowly developing countries or regions. You can find all my work at guymcpherson.com. And I'm on most of the social media, but I just announced this morning that I'm jumping off of essentially all social media except YouTube in the near future. So you continue. I'm Nature Bets Last. I appreciate the opportunity to chat with you guys today, and we'll look forward to another time.
Absolutely. Yeah. Thank you so much, Guy. This is very interesting. Again, a lot more here to talk about. I'm also, we talk about these things. This is the psychological hurdle I'm sure you face with practically everybody you discuss these issues with. There is an inherent resistance to even facing the idea by a lot of people. And then on the other hand, I also see this. I see from people who probably don't know nearly as much as you about these issues, an over-readiness to accept that things are just messed up. We're all just screwed. Things are over. It's a weird sort of dualism thing. I don't mean to put it too much in a binary, but I see people in both of those camps. I could see people going to both of those psychological extremes in the last maybe 20 or 30 seconds, because we're about to wrap up. What do you think about that issue?
I couldn't agree more. The primary responses to my work have been defamation, betrayal, plagiarism, isolation, rejection, derision. So because I've been connecting a few dots and pointing out the science that other people are producing, I have come under serious scrutiny, we'll say, to put it mildly. And so I can understand why people wouldn't want to go down that path. But on the other hand, what if it is as bad as I'm indicating? What if it is as bad as the evidence I cite is indicating? Well, that tells me that we need to do something a little different, because business as usual is not working. So that's where we're at.
Thank you, Guy.
I'm willing to try something new.
Yeah, thank you very much for joining us. We're going to have to close it out. I just want to say thank you again. Even though we disagree on some things, those are disagreements. I'm hoping we can work out on the show. We can work out on the future. And it's a shame. It's a damn shame that people like yourself who are pushing these things, who have a legitimate perspective, who are coming at it with the scientific perspective, are getting pushed out for reasons that have, as far as I can tell, nothing to do with science. So thank you again for joining us. Hopefully we can have you back on soon. And good work. Keep up your independence. Really value that. Regardless, we have another great great hour coming up. You're listening to the most disruptive show in the multiverse, Fault Lines with Thomas and Stranahan. Be back in just a minute.
Listening to Radio Sputnik. Telling the untold.
Fault Lines.
Live again from the aggravated states of America. It is time now for the most curious morning talk show in the universe, in the multiverse, in the anyverse, sitting on an independent rock we call the Earth. I am radio show host Shane Stranahan.
And in the unapologetically left corner, I am the indefatigable, ever vigilant, the last man on the wall, your political analyst, Jamarl Thomas.
Hey man, we're sitting up there on the wall together,
That's right.
I think. Although, hopefully. All right. Together, we are the disruptive duo that make up Fault Lines with Thomas and Stranahan. All right. Getting back into headlines here. Although, man, this dismal perspective we have on the world. Are we all going to die?
Yeah, I told you he's the most terrifying man alive. Like, he's affable. He'll give it to you straight, like, this is what's going on. But after listening to him, you're like, wow, that sucks. That's horrible.
I really want to get into it, and not in a super aggressive way, but I want to get into it because these are really important issues. You know what I mean? Yeah. And in that tussle, you kind of strengthen your own ability to understand these things. You learn facts, you learn theories, you learn more, and in some sense, that's really what we're all about. Regardless, though, we've got some news to get through. Let's get through these headlines. Important stuff. In our first story, after a group of 239 scientists sent a letter to the World Health Organization urging that they address airborne transmission of the coronavirus, the WHO on Tuesday acknowledged evidence emerging, that's in quotes, evidence emerging of the airborne spread of the novel coronavirus. President Trump has also formally notified Congress and the WHO that he is withdrawing from the World Health Organization, criticizing that organization's handling of the coronavirus pandemic. Texas is reporting more than 10,000 new coronavirus infections. That is a single-day high in terms of gains. It's also seen hospitalizations more than double over the past week, with 9,286 patients now hospitalized. The state has also said that it's seen its highest single-day death toll yet. 60 people died from the coronavirus or its comorbidities. Dr. Anthony Fauci is one of the key people in the White House, in the administration, responsible for handling the coronavirus task force. Dr. Fauci has said he is, quote, strongly in favor, end quote, of mandating mask use amid a rise in COVID-19 cases in Alabama and around the nation. Meanwhile, in Georgia, Governor Brian Kemp has said he would not support a government mandate on wearing masks. In Brazil, President Jair Bolsonaro has said he has tested positive with the coronavirus after suffering from a fever and muscle aches. He was given a chest x-ray, a lung x-ray. Brazil is second to the United States in the number of total deaths attributed to COVID-19. Meanwhile, China has opened a new national security office, its first national security office in Hong Kong. Hong Kong's government has also banned children from engaging in disruptive political activities in schools. This would include boycotting classes, creating I forget what they call these things, but where you hold hands with each other and you create like a rope or a line. They're banning that. Also specifically banned the singing in school of the pro-democracy song, Glory to Hong Kong. In Serbia, riot police have fired tear gas to disperse protesters who stormed parliament in response to the imposition of a coronavirus curfew in Belgrade, that nation's capital. Protesters there said they were angry because the government eased restrictions to hold last month's parliamentary elections, spurring a rise in new cases. A report from Human Rights Watch said that more than 180 bodies had been found in mass graves in northern Burkina Faso, where government forces are fighting in Islamist insurgency. The group said the bodies appeared to be the result of extrajudicial killings by the army. Back in the States, a statue of former President Andrew Jackson placed in 1822 will soon be moved from outside of the city hall in Jackson, Mississippi. Again, that's a city named for the president whose statue they're removing. City Council voted 5-1 to remove that statue. But again, to repeat, the city itself is named after the 7th president. This stuff's confusing to me. In our last story today, maybe we'll have one more after this, actually. I see Jamarl posting something. Major League Soccer begins its season tonight in Florida after the organization paused 4 months ago. The league's teams are sequestered in resorts for the duration of that tournament, which will be played without fans at ESPN's Wide World of Sports complex. That's at Walt Disney World. And major retailers are pulling Washington merchandise from online stores amid call for team's name change. That would be, again, I don't know if I can say this. It's a little bit. Yeah, of course I can. You know what? I'm going to. You were reading about this tomorrow. I'll let you take that story. You're all cut up. That's the news. You're listening to Fault Lines with Thomas and Stranahan. So, Jamarl, you just posted this story in our little chat. Do you want to get into that? Do you want to talk about that real quick?
I'll talk about this. Major retailers pull Washington merchandise from the online stores and call for a team name change because people have been basically saying that the Washington Redskin name is racist for obvious reasons of the whole Redskin stuff. That's somewhat of a derogatory term used by the people who basically slaughtered them. So you can imagine that if you were slaughtered by a group, then you may not necessarily want to be named by that group. Well, the team has basically taken this name on and ran with this team for, I forget however long. And despite calls to say, change your name, this is brutally racist, well, they don't have a huge contingency in the United States for obvious reasons. They've been wiped out in order to make that pitch that much louder. Well, with all of the protests and all of the information, all of the energy being given to this notion of, okay, we need to have a reckoning with the history of this country, well, this has become back on the marquee in regards to changing their name. You had other teams like the Braves or like here in Richmond. Well, in Richmond, we had the Richmond Braves. They've changed their name to, I think, the Richmond Squirrels. You have other teams, I think, in baseball also that are up for changing their name. Well, now you have Washington. Now, the catch here is that they don't want to change their name for capitalistic reasons. It's branding. They have all of these things that are branded a particular way. They want to be able to sell those products. Well, in this case now, the fiscal incentive is now under pressure. Because if you have a situation where companies stop selling your goods and products, well, what do you do with that situation? And does that put more pressure on you to potentially change it? The answer is yes. I was at my wife and I went to a Native American reservation where they were doing kind of like a cultural show. And they were doing the dances and everything else. And they gave away a prize where the kid walked up wearing a Washington shirt. Now, I, at this point, didn't necessarily get the entirety of this issue until that moment where it became clear. And they stopped the proceedings and they said, look, in the case that you want to be respected and not be called various names that you find to be derisive and offensive, we demand that respect also. And you coming here with a Washington shirt on like that is problematic for us. And it would be no different than you wearing a shirt that's basically saying like the Washington Negroes or whatever. That's when it hit me really, where I was like, oh, I see it. And from that point on, it was I had a certain perspective of this, where it's like, no, you need to change that name. The name is brutally offensive, and for the group of people who are saying that, you should honor them. Now, you have a small contingent that Washington used to pay off to basically be the leadership of saying, hey, we're okay with this. But the underlying body of the Native Americans, especially many of the tribes, are not. And in this case, they're being pressured to change their name along with some of the other companies. So that's basically what this is coming from. Major retailers saying, okay, fair enough. And the same way that the Aunt Jemima thing we're having problems with, we also have problems with this. And now they're under pressure to change it. So they apparently have put out a press release saying that we're in talks to figure out what we're going to do with this situation and whether we're going to change the name and what it would be changed to and all this other stuff. But right now, a lot of pressure is being applied to them. And it seems that the pressure is drawing, let's say, drawing gains. So it's interesting. All of this stuff is all of a sudden taking place within the course of a few weeks. And I mean that across society-wide. Like whether it's the statues coming into question, the Confederate statues coming into question, and I'm not even talking about the ones that were pulled down. I'm just talking about the conversations that have been having at various state houses. For example, the one with Andrew Jackson. And the city is named after him. I was like what? The school school is named after him. Like, that's mind-blowing. That those things take place. Or like the Washington Post, and you find out that it's like, well, wait a minute. Your paper is named after George Washington. What are you talking about? But these questions have now come up. And for the first time in my awareness, this team has actually started to actually take these seriously. So that's where that's coming in from, Shane. What do you think about that? Do you think they should change their name?
I mean, I guess so. It's not up to me. I mean, probably that is offensive. Here's my thing with all these things. Yeah. I don't know. Maybe I'm not outside of it, but I've always felt like I'm outside of this stuff. It's not my team. I technically live just outside the city. I think they should probably change it because it does seem like it's offending people, and that's not good. I understand why people are frustrated by other people telling them what to say, because that is a deeply held American value that you should not be told what to say. So I understand that, but it's a deliberative process, and it's not like there's somebody who's coming out with a law, as far as I can tell, saying that we can't say that word. There's certain words we can't say on the radio due to FCC rulings, all that stuff. As I went through that, I was sort of stumbling, and maybe this is another way to look at the issue. I was like, wait, should I be saying that word on the air? That's pretty offensive.
Uncomfortable with that.
Yeah,
far more than I think I do.
And that's a cultural thing. Yeah. Like maybe again, I'm stumbling over this because it's a difficult issue, and I don't have my thoughts entirely clear on it because there's nuance that I haven't learned to understand. I haven't lived as a Native American. I'm not a player in that team. I'm not inside the industry. I don't know all the incentives. I just know that it's complicated, and I think that we should change that stuff. Wait, somebody's calling my room. Please take it over. Okay, there we go. It's over.
No,
I don't know if you heard that.
No, I understand where you're coming from with that. I mean, I guess for me as an African American, I guess there's a little bit more leeway in society in saying stuff like that because it's sometimes it's directly applicable to you, where outside of yourself not so much. But like I said, my grandfather was 1/4 Cherokee. We were never brought up as a mixed race. We were always just kind of brought up as African Americans with just this knowledge of this ancillary part, of this other part of your family line. And so even with that, I didn't necessarily get it from flesh to bone until I saw it in other people. I mean, we do have experience with this in our society. I mean, think of African Americans. You have a horrible name where you've turned these people into slaves. Then you have this other name that is just offensive. Then you have Negro, colored. And over the course of time, those things change. And as they change, you get a societal, almost a hegemonic shift of saying, okay, this is the way we're going to do this now. And these other ones are kind of offensive. And so that change almost happens without anybody really being at the helm of the controls. It's your society just kind of comes to a reckoning of what it accepts or what it doesn't accept as normal and as proper in a particular context. And so these reckonings have taken place before. It's not necessarily like a mind-blowing thing. I think this is just the first one that I'm in, where I have to kind of adjust my own tenor of stuff just because of being brought up, raised, moving through a system. For example, the Confederate statues. I mean, my initial argument was those things have been there forever, and taking down a statue doesn't necessarily change the history of that statue. And I realized, well, a lot of that, though, has to do with the reverence that these statues are in, and maybe I need to change my tenor in regards to where I think about this stuff, and that stuff needs to change. I think it's like that with the team, too. It's not so much that I think people want to be told what to say. I think people resist that just, immensely in general. And I think part of our problems with our society is we have this cancel culture or this hush culture where it's like, oh, I don't like you saying that. I don't like you saying that. Missing the point that the moment that you shush people and tell them what not to say, they're going to take massive offense to that and push back on the fact that you're trying to tell them what not to say. There's a subjectivity to it. And our window of acceptance need to be expanded in regards to what we can accept as conversation, so not shut people up and allow those people a space to get across their grievances and their complaints. Because as you said, the areas of disagreements are areas where if you're engaging it honestly, you can expand your own point of view in that conversation. And that's not something you can do if everybody just says, yeah, we agree. But no, I feel you, man. It's a weird moment to be in because it feels like things are changing and it feels like there's a reckoning of sorts. And it's like, where does that end up and where does that land? And that's not entirely clear from where we are.
Well, it's not clear, but it's also exciting. Yeah. I want to be clear. There are a lot of changes here that, a lot of changes going on in the world. We were just talking about some of them that we shouldn't like, we shouldn't want, we should try to oppose. But we're also living in this time of crisis. There's the arguably corrupted translation of the sort of Chinese proverb or whatever. The definition of crisis is a danger and not an opportunity. I've read into that a little bit. That's not exactly right, but something in there holds true. We're living in this dangerous time, and we're living in a time of immense opportunity. There's a lot to look forward to there. And so the emotional tenor that we're going to have to take as we deal with that, it's complicated, and we're kind of working that out both in public and independently. Literally in public, we're as connected as we've ever been through the internet, and literally in private, because a lot of people are living in lockdown, they're stuck in their homes. And so it's this weird contradiction and inversion of expectations that nobody knows how to deal with. Nobody's ever had. Again, we're 500 generations away from basically being a species of fairly well-developed small tribal societies with complicated little local institutions and all this stuff. We've suddenly, in the course of a few thousand years, just a couple hundred lives, developed into this massive global international civilization. I don't know how the heck we can wrap our heads around any of that. So having some sense of humility, I think, helps a lot when we're dealing with people we disagree with. Regardless, though, we can keep that conversation going on the other side of this break. We'll be taking calls, 202-521-1320. Again, 202-521-1320. Feel free to call in. Regardless, we'll be back in just a minute. You're listening to Fault Lines with Thomas and Stranahan.
Lines. 24 hours a day, 7 days a week. We give you the most essential information out there.
Yeah, we're doubling down on crazy. We're doubling down on our new show called Double Down on Sputnik. It's doubling down on absolute joyous radio nirvana. You will love it. You will want to listen to every single episode on Sputnik. Bye, y'all.
Fault Lines.
And we are back again. You're listening to Fault Lines with Jamarl Thomas and Shane Stranahan. We're taking calls this segment. You can call in 202-521-1320. We're also giving out info on where you can find us. I'll just do that now real quick. If you're in the DC area and you want to listen in, you can. 105.5 FM and 1390 AM. Alternatively, if you're in Kansas City or that area, you can check us out 102.9 and 104.7 FM, as well as 1140 AM. Also, we're on Periscope now, twitter.com/faultlinesradio. Just Fault Lines Radio, that's our name. You go up there, you'll see right at the top, we have a live feed. Also on YouTube, if you go over to Jamarl Thomas's channel, just do a search for Jamarl Thomas, you'll find him. You'll see we're live there too. You can see his face moving. You can't see mine moving, but maybe you can see mine there. We're also on Fault Lines Radio. That's the other YouTube channel. Man, we've got to deal with this stuff. Some stuff to condense there to figure out. You can also listen to the audio, Spreaker, Stitcher, iHeartRadio, Apple Music. And I'm missing one there, but you know what? That's pretty exhaustive. At least I'm exhausted. We're going into a Taking Calls segment. We're also going to be talking in about 15 minutes with Scott Santons, talking about UBI, specifically unconditional basic income. UBI, usually referred to as universal basic income. He takes it a step further or a step deeper. We'll be talking about that, as well as just general issue of automation, what we're seeing in the world right now, whether UBI is a just response or a practical response to the economic problems a lot of people are dealing with across the country. Ooh, I'm going to take a breath. I was saying some stuff there. Jamarl, take over.
UBI. I like that. I do think, we're going to get into this with Scott, but I do think it's a good idea. I mean, ultimately, we have a situation where, well, how can I say this? It's more nuanced. It doesn't get rid of very few people having control of the means of productions, which is my issue with the whole UBI thing, absent a recognition that that's where part of the problem lies. But that's going to be with Scott. I want to talk about the Hong Kong law. So China puts out a new security law. Now, as we mentioned, this new security law has caused a certain degree of consternation across the world without having Hong Kong as its pivot point into China. Now, the Soviets, let's take a little history tour. Back during the time where the Soviets was basically controlling Afghanistan, the United States was working in a clandestine way to operate in Afghanistan. The Soviets knew about this and took a heavy-handed approach into dealing with it. And in doing so, the world points the finger and says, oh, look at what they're doing to that country, Afghanistan. Now, the catch here is the fact that the U.S. was working clandestine wasn't necessarily the thing that people saw. What they saw is just the response. The U.S. assisted with weapons and munitions and Stinger missiles and whatnot to push back and to basically create Russia's or the Soviet Union's own Vietnam. Now, when we look at Hong Kong, we're seeing something similar, where you have this clandestine action that's taking place in Hong Kong, used as a pivot point to try to go after China. China is completely aware of this. They know the techniques, they have their own intelligence that can see what is clearly taking place. I mean, these guys are out there raising American flags. And in doing so, they responded. Now, they didn't respond heavy-handedly by sending in military force, but they were basically showing we will respond to this and we will not accept any intervention into our own system any more than the United States would tolerate. It also must be understood that after what took place in regards to them ripping away Hong Kong over the opium war stuff, we want to sell opium to your community. No, we don't want you to do that. Fine, we're going to take Hong Kong and we're going to punish you for it. Well, because of that, you can imagine that China has certain insecurities about sovereignty and made it very clear that they won't necessarily have any of these other countries, especially Western powers, trespass on their sovereignty once again. It's a rational act, and it's a rational response for a country that felt like they were stepped on. Now that they're strong enough to prevent that, they are going to prevent that. And if you put yourself in their shoes, would you also do the same? The answer is yes. Any sovereign country, any sovereign power that believes that it has a philosophical right to expand, just like any other country had a philosophical right to expand, will take precautions and to ensure its own sovereignty is assured. China is doing no different here. Now, the catch is we're in the United States and we don't necessarily like them doing that, so we wag our finger at them over this. But any country has a right to protect its sovereignty. And if there's another country that is using clandestine means or otherwise to undermine that sovereignty, it makes all the sense in the world that the country will respond. Now, whether you think the human rights or this law that they put in place is the correct way to do about that is almost secondary to the fact that you should, at the very least, acknowledge that they have a right to maintain their borders. Now, Shane, what do you think about this? Because I know you've seen this particular story, and we talked about it briefly, I think, the other day, in regards to the law and the reasoning for the law and the justification behind it and why they're going this route and so forth. But what do you think about it up to this point?
I don't like a lot of stuff about China. I don't like a lot of stuff about what China's done to Hong Kong. But that has to take place within the context of who am I to say? Who am I as an American? Who am I within this governmental system? Who are we to have a say in what they're doing? I mean, say there are people who want to leave China and who are trying to find someplace safe to stay. I think we as Americans, as a country, should be open to taking them in. Yes. I think that's about the extent to which we should try to involve ourselves. There's this other perspective, this conversation about human rights and the other side of a right is a duty. You know, if I have a right, you have sort of a duty to at least respect that right, to attend to it, to transgress the bounds that my right defines for myself, especially with negative rights. Positive rights, it gets a little bit quirkier, but here's why I'm bringing it up. If I were to look at the United States and China, if I were to compare and contrast them as it relates to this dichotomy, I would say the United States sees itself as having all rights and no duties, and China sees itself as having all duties and no rights. And I don't like either of those. But for our country, which is so deeply predicated on the Bill of Rights, on the idea that, you know, people should have rights, I think we need to take a little closer look at our duties to each other. And that's complicated stuff, and we're kind of out of practice of having that conversation. I think the idea that we have duties to each other is in some sense intrinsically foreign to a lot of the philosophical foundations of our country, but we're a country. We are constituents of this larger whole to whatever extent we are, you know, not just individuals. And therefore we have these duties. We have this deep obligation to each other, and it's up to us to determine what exact shape that obligation takes, but we need to have that in our minds. Otherwise, we're just moreless. You know what I mean? We're just sort of adrift in our own little world. And to the extent that we are adrift, to the extent that we don't feel like we have a duty to other people, we also, in some sense, don't have any real connection to them. If you don't have any moral obligation, and I don't mean to take this too seriously, because I think that every human being on a very basic level feels moral obligations, to the extent that they're not a psychopath. In some sense, this is just baked into our humanity. But it can take a political form, and the political ideas that we bring to our definitions of our natures shape how we sort of act those things out. I think we could do well as a country to come back to this idea of our obligations, of our relationships with other people, of the impact we're having on other people. And I'd like to have that conversation on all levels. I think that I'll close out with this. we've been having that conversation on a cultural level. We've had, in other words, on a fairly high social level, where we're literally talking about whether this or that is an appropriate thing to do on the sort of surface level. I think that if these things are dependent on more deeply held beliefs or principles that are articulated in the Constitution and articulated philosophically in the predecessors to that Constitution, the intellectual precedent, we should also have it on that level. And I don't think we are. I think we need a living relationship with our Constitution. We need to be able to talk with it, to change it, to dance with it. We need to have that interaction. And so long as we don't have that, it's no wonder that our society, our culture, these higher levels are going to be declining. That's my take.
Yeah, I think I know where you're coming from with that. Basically, it's not for us to intervene into the affairs of another nation, even though assisting, meaning being on the outskirts of trying to stay on the side of democracy and liberty and those type of things, is prized and should be something that's done. Meaning, so if, like you said, if somebody wants to leave, fair enough, but we shouldn't necessarily try to intervene by putting sanctions or some kind of iron fist on that. At which point does that change, though? Well, 2 points. The idea of rights and the argument of that this group has a certain degree of rights and these rights are inalienable and so forth, that's just a factor of law. That's not a factor of reality. I mean, there's nothing to enshrine that by God that says an individual has any sort of right at all. Those people just basically are in a free fall for existence, and we come up with some kind of organization to which we try to get along. But that's not internal. That's external world stuff that we kind of just agree upon. It's not a flat fact reality, right? I mean, it's not, we call it inalienable rights, but that's a document that causes it inalienable rights that we just kind of appropriate and say, okay, this is our living situation. Another country can come up with a completely different living situation and all of them be perfectly content in that living situation that we find to be abhorrent and they find to be perfectly normal considering our system to be abhorrent. That's what I mean when I say these things are not factors of human nature. Oftentimes these things are factors of law that are imposed when we grow up in it for so long that it just comes across as human nature. The second point, when would you intervene? Like, is there anything, if there was a genocide being committed into a country, would that be just cause to intervene into the affairs of the country?
I think the second question depends on the first. I think the first question, therefore, is what really matters. Like, what is, like, for one thing, let's just start with this. Is there such a thing as human nature?
You asking me? Yes.
So if there is such a thing as human nature, what relationship do you think human nature has to the laws that humans together create?
Well, I think human nature in this standpoint, let me be very clear. Human nature is specific to a particular system, meaning how a person behaves or how a group behaves. If I send X number of people down a particular rabbit hole of life, and if 70% in the exact same situation deal with it poorly, then I can say, look, from a human nature standpoint, in juxtaposition of this particular environment, because there's no situation where a human being is floating in a vacuum. That human being always has something that's interacting and engaging it to evoke a certain response. So that's when I say human nature, I always include environment into that because I think environment is intrinsic into expressing the human nature, if that makes sense.
It is, yeah. I mean, another perspective on that, though, is that humans are immensely adaptive. And so in some sense, environment might not have as much to do with it as if you view human beings as a sort of pluripotent seed, where a human being can become one of many different things. And it's going to depend on genetics. It's going to depend on culture. It's going to depend on all these different things that go into making them. Humans are going to act differently in different cases, sure, but there's still a seed. That's the seed I'd call human nature. But yes. I mean, another take. We only have about a minute left here, so it's a big conversation where there's too little time to really get too deep into it, but we keep coming back to them. So hopefully we can kind of nick away at it over time. Yeah. Another perspective here is I mean, go back to Aristotle for a second. Human beings aren't individuals. Humanity is not an individual, except if you want to take it in some weird direction. Humanity can be divided into individuals, but here's the point. Yeah. We're a social species. In fact, I would say we're the most social species ever of any, unless you want to say, no, we are the most social species ever. That's the thing. We didn't just form small bands. We formed whole states. We formed these sort of multinational empire things. That's the furthest extent it gets tyrannical. But I think unless we can reconcile ourselves with that nature, unless we can have that representation, we're going to have a hard time sustaining those states. I think in a real deep way, that's actually what this whole humanity thing is about in some sense. From our own conceptual cultural perspective, we're in that constant relationship with who we are, what we can become. We're having that conversation. And hopefully you and I can keep having that conversation. But we're going to go into a break here. We're going to be back in just a minute, joined by Scott Santens, talking about UBI, unconditional basic income. Be back in a minute. You're listening to Fault Lines with Thomas and Stranahan.
Fault lines. Tough questions are the most powerful weapon we have. As long as you have questions, we'll keep asking. Radio Sputnik. Telling the untold.
So, Sean, what do you want to talk about today?
Well, Bob, that's easy. I want to talk about the need to stop the development of self-driving cars.
Again, Sean, you're driving me nuts. I think the self-driving car thing's already out of the gate.
No. It's never too late. See, now the leading experts in the field, I mean, just pick one, whichever one, leading experts have repeatedly warned us about the dangers of artificial intelligence. Look, I'm telling you, man, we have to stop the robots by any means necessary.
I see what you did there.
Yep.
Tune into our show By Any Means Necessary daily from 2 to 4 p.m. Eastern Time on Radio Sputnik. And don't forget to call in at 3:20 p.m. to our studio number 202-521-1320.
And if you miss us live, check us out on SputnikNews.com, Spreaker, iTunes, iHeartRadio, Spotify, or wherever you listen to podcasts to stay up to date on the latest political, social, and economic movements shaping the world around us.
Fault lines.
Welcome back to Fault Lines. My name is Jamarl Thomas. I am here with my co-host, Shane Stranahan. We're coming to you live out of our station in DC. If you guys are in the area and you want to catch us on the radio, you can do so at 105.5 FM and 1390 AM. We're also kicking around in Kansas City at 102.9 FM and 104.7 FM. If you guys are really digging what Shane and I are putting down, whatever platform you're consuming us on, give us a like, share this video. You can also join this conversation with a chat, a tweet, and of course, you can reach us by phone at 202-521-1320. Coming up is going to be a really good conversation. We have Scott Santens. He's a writer, full-time advocate for unconditional basic income, acknowledged by Andrew Yang in his book, The War on Normal People. Yang recognized Scott for having helped shape his thinking, actually. Scott has been researching and advocating for UBI around the world since 2013. Scott, welcome to the show.
Hi there. Thanks for having me.
Absolutely. I appreciate you for coming on. So tell me, how do we prevent another Great Depression from coming up? Because with all of the people, I think 40 million jobs went up in smoke almost immediately. On top of the 40 million jobs going up in smoke immediately, you have an eviction apocalypse that is basically coming up at the end of the month. And while all of this drama and chaos is taking place, I think something like 43% of the jobs were expected to not come back anytime soon. We have billionaires who are doing gangbusters. I mean, Jeff Bezos is expected to hit trillionaire status by 26. So for the ordinary person in this public situation that is now out there marching and protesting, and that marching and protest will probably get that much more over the top the moment that the eviction notice hits, and for that matter, the moment that they lose all ability to either maintain by getting like $230 a month once the extra stimulus runs out. How do we, as a country, as a society, prevent from going over the abyss of a Great Depression?
Yeah, I think people need to understand here that we have a 70% consumer-based economy. So, your spending is someone else's paycheck, and then they spend that, and that's someone else's paycheck. So this all requires spending. And it's also important for people to understand that it's kind of magical thinking to believe that we can just reopen the economy, and even if people had the same amount of money that they had before, that there are permanent or at least long-lasting changes in consumption habits. So it's not like, say if you reopen a restaurant, then people are going to immediately flood into that restaurant as they did before, because we are in this COVID environment, there's no vaccine, and people are just going to be like saying, okay, well, let's figure out something else other than going to a restaurant, let's order takeout or something. So it's not just entirely a money situation. And then so we need to understand that, okay, we have to make sure that people can still spend. And let's even make sure that people can spend more than they usually could, because they're not going to be spending in the same ways that they were before. So when I say that, I mean that if you're less likely to eat at restaurants, then let's make sure that people even have more money so that this will actually stimulate the economy, and then they'll be more likely to spend in their local economies in other ways. I mean, that's really how we avoid this stuff, especially if we cut off the $600 per week unemployment boost. Then we have to understand that is going to have a massive impact on spending. It's not only about, the basic stuff is saying, okay, people have to pay their bills, but also people are not going to be spending as much as they were before. And that's going to create a vicious cycle, and that's going to hurt you, even if you seem to be okay. And it's because it's funny, this ties right into the conversation you were just having before this, is that we are all interdependent. Our economy is a system of interdependence. And so if we hurt ourselves by, say, being against other people having spending money, because we actually do have this, consumer-based economy. And that's really important to make sure that people have money to actually spend into a consumer-based economy.
And that's what the whole notion of we need to have a basic income for each and every person to operate by. And I love that you say that, because, I mean, to me, I look at our world and I make the point that says, look, there's no entire point to our existence. And in doing so, there are things that we need to get from point A to point B. And the question becomes, what are those things? Oftentimes, we have people who take ideological positions on this stuff and will rule out something like a universal basic income or but I think your point is, look, if we're going to make a life, and we're going to make a life, whatever life we make is interdependent with other people who are trying to make their lives, and undermining somebody else ultimately hurts you in that process. And the universal basic income is a way to ensure that each and every one of us have a basic level of subsistence as we operate in a society and in an economy that basically has expropriated a huge amount of those resources to the upper class, draining it from the people who actually need it and from the people who make our society run.
Yeah. I mean, I get asked often, how do we pay for basic income? And it's interesting, if we go back just to the 1970s and we rewind the clock, and we do not allow inequality to increase since then, and therefore we make sure that all the economic growth actually flows to everybody instead of just the top, then in that situation, we all right now would be earning an additional $12,000 per year. So, of course, we can afford basic income. It's just that we have let things grow so incredibly unequal that those at the top are essentially garnishing all of the productivity improvements and economic growth that we have together built over the decade. And I think another way of looking at this, too, is to look at, say, the game of Monopoly. And when you play Monopoly, you all start with a starting amount of money, and then you always get money for passing go along the way. That money actually makes the game work. Like, the game would not operate without that money making it possible. And it's not only the money that makes the game work, but of course we are living, breathing human beings. And we have arguably a right to our existence. Like, if we take the existence away from somebody, if we choke them to death, then they lose their lives. And so if we are withholding what people need to live from them on the conditions that they do certain things, then are we recognizing the right to life? So I think it's important that if we want to really recognize the right to life and a right to freedom in this country, then we have to make sure that the resources that people need to live are unconditional, and that is unconditional basic income. It is a recognition that we all have the right to live, and we all have the freedom to say no to people who would wish to use the withholding of resources to make us do things.
So there's a lot that we could talk about there, but that specific one, the balance between the two perceived rights, the right to life and the right to freedom, like we were talking earlier about the balance of rights and duties and how every right implies a duty. Life and freedom are each sort of totalizing forces in terms of rights. So there's a lot more we could talk about there. I just want to sort of peg that, though. One other thing, you were talking about monopoly. I was actually just reading about this yesterday, the origins of monopoly. It's actually Lizzie McGee, a Georgist sort of socialist woman back in the late 19th, early 20th centuries, actually created the landlord game, which was the predecessor. It was the direct inspiration for the origins of monopoly. She didn't make that much money. It kind of got taken by her. But yeah, if you Elizabeth McGee, MAGIE, you can look into it, and it's all there. So just an interesting little thing where even the person who created the predecessor for this game, who really created this game, as far as I can tell, the rules seem pretty similar. The board looks basically the same. The person who created this game was trying to make an ideological point about the problems of sort of this recurring early successes and how that creates these deeply embedded divisions in this economic hierarchy, and how the person who created that, her message was effectively co-opted by a company, and now the game is played by people who aspire to live out the dream of being a successful capitalist. So it's just an interesting sort of sad little thing there. Regardless, though, there's one. Go.
So I was just gonna say, another really interesting thing about McGee's version is, so she had two sets of rules for the game, and one was basically essentially traditional Monopoly rules, and the other was this setup of rules, and called basically the game was called Prosperity, playing with these rules. So the goal of that game was through the sharing of the essentially was a land value tax that was applied to the properties. So it was a recognition that the value of land was communally created, and so that the community should receive, a share of this rent that goes to everybody, and in which case everyone would be better off. And so the winner of the game, in order to win prosperity, then every single player had to reach above a certain point of prosperity. So it's not like the first one to win had all the money. It was that essentially everybody won because everyone had at least a certain amount of wealth in the bank. And I think it's just really interesting to think of. It's like, what is the goal of society? Is it that winner take all, or is that we all win somehow?
Yeah, ideally, like you're saying, we're constantly raising the waterline of what any given human being in that society can expect to do with their lives. This is, there are a few different directions we could go with this. We're going to have to go into a break in a minute or two. I'll just briefly throw out Georgism. You were talking about the land value tax. I actually don't know that much about Georgism. I looked into it, haven't read the books, though. Still have to get to those. But that seems to have been deeply influential, specifically in America, but around the world, too, in terms of sort of radical economics, going to the foundations of economics, rethinking how we live, how we work together, how our economy works. From your perspective, either personally or historically, looking back at the chain of events, what was Georgism, just briefly, because again, we've only got about a minute or two left, but what was Georgism, and how has that influenced your thinking and general economic thinking since then?
Yeah, so Henry George wrote a book called Progress and Poverty, and that was essentially like the first, say, political bestseller or economic bestseller, where he was trying to popularize this idea that we all should pay into, say, a ground rent, and also very similar to Thomas Paine, but you pay a tax on your land, so you don't essentially, own it outright, but you do pay a permanent rent on that, because we're recognizing that nobody, built the earth, nobody built the land, everybody should actually share in that value. And I think it's his viewpoint and Thomas Paine's viewpoint stands today as just being a very strong argument for universal basic income, and also just in general with the purposes of all this, what purpose of civilization.
That's a very interesting thing. Yeah, high conversation, very interesting conversation. Delighted to continue this, but let's go to the break kind of early now so that we have more time on the other side to get back into this stuff. We're happy to be joined by Scott Santens, who is a writer and full-time advocate for unconditional basic income, UBI, not universal basic income, although I think he's pushing for that too, but unconditional, a more clear version of universal basic income. Regardless, we'll have Scott back on the other side of this break, be talking to him again. Be back in just a minute. You're listening to Fault Lines with Thomas and Stranahan.
Fault Lines. Radio Sputnik. We speak your language. Find us at SputnikNews.com.
What's the most important hour of the day? It's the Critical Hour with Dr. Wilmer Leon. On this show, we don't just deliver the latest headlines, we divide the real from the fake. Tune in to hear from some of the most brilliant political minds of today, get in-depth news and analysis that goes beyond the surface and dig straight into the details. Set your clock to the Critical Hour for a news perspective unlike any of those other guys. Tune in to the Critical Hour with Dr. Wilmer Leon, weekdays 6 to 7 p.m. Eastern, and catch us on Facebook Live. You're listening to Radio Sputnik.
Fault lines.
And we're back. I just want to give a quick shout out. Fault lines with Thomas and Stranahan, but here's the shout out. We're talking with Scott Santens. Get this in right now. We can hopefully get this in at the end of the hour too. You can follow Scott on Twitter, SCOTTSANTENS. You can also check out his work on his website, scottsantens.com, spelled the same way, SCOTTSANTENS.com, by the way. Regardless, happy to be joined again by Scott. We're talking about Georgism just now. I actually wanted to shift pace slightly, if that's okay. We ended on a sort of global, cosmic note even. The course of civilization. It's global right now. It could be cosmic soon one day. Regardless, though, there's this other conversation. We had somebody on last week talking about modern monetary theory. Briefly, I'm sure you're familiar with modern monetary theory. How do you see that tying into your calls for a UBI?
Sure. So just kind of to simplify modern let's just imagine that the start of money is actually at government, and so what government spends into the economy is kind of the origin of money. And instead of like this kind of circulation where people spend money and that money is taxed, that taxation actually essentially destroys the money. So there's a beginning point and an end point. And so the logic there is to say, look, what are the things that we need as a society? What should, the government be putting money into? And that includes the private sector. And so just spend that money. And so, go ahead and don't worry about limitations of how much stuff is going to cost. Just say, all right, we're going to have universal health care. We're going to have universal basic income. Look, we're going to have, this kind of, military and schooling, education, and, get this money out there. How much money does the private sector need? And then on the other end saying, okay, we do have to still worry about inflation. So what do we need to tax in order to prevent too much inflation from occurring, to find that balance? But then we say, all right, well, this is what we're going to tax. This is how much we're going to tax. And that's the way that you kind of set up that system. And so when you think about it in terms of UBI, then yeah, you're not constrained by this idea of how much taxes do we have to raise to do this, and first, like who do we have to tax first? How do we get that money first? Just saying, look, just pay for UBI, and then we figure out on the back end where and what we should tax to what degree.
That makes sense for the MMT thing. I think when I hear these type of conversations, something in me goes aflutter. Because when I first started my channel, it was basically with conversations like this, that the society can be really about whatever you want society to be about, providing it's a stable organization of energy in the way that human beings operate within it, meaning the incentives and the drives don't try to tear the system down, but it actually has a cooperative model of trying to build it up. You hit this other point of freedom. I mean, basically a person who's working 40, 50, 60 hours a week cannot claim to be free when the majority of their time is spent working at a job that they may not necessarily like. Whereas having a UBI allows you to have personal choice in whether or not you're going to accept one job or the other. Because at the very least, you have a basic income that would pad you in making that choice. And so when people argue this notion of freedom and that working all of this time is freedom, it's the opposite of that. In fact, if you're talking about freedom, you're talking about being able to make a choice in regards to what you do for a living without necessarily being compelled by the vulnerability of your own needs. Is this kind of your perspective of society in the case of like, look, we can have a better society? And within the context of that, how much are you talking about giving for UBI, or is there some other metric that makes the determining factor of what that number is, and it's not necessarily just a happenstance number?
Yeah, there are definitely different conceptions of freedom, and I think kind of a commonly understood one is that, say, just freedom is the freedom to do what you want, or to not be constrained from doing what you want. But also, it could be understood as do you have freedom if someone else is able to decide for you basically what you are going to do? Like, freedom should be also considered to be, are you free from people forcing you or coercing you into things? Like, you should be able to have the power to say no to everybody because you actually have this unconditional access to resources. And this is not something like it didn't. It's not like it's brand new. If you rewind thousands of years ago, like, we did actually have more freedom in the sense that we weren't constricted, we weren't limited from our access to land. And so, like, the earth itself was a form of common natural inheritance, and we all had that access. And then what we did is we actually locked it up. We created private property, we locked it all up, and we put it behind these, essentially, that you need keys now called dollars in order to access. And, that's fine in that it creates civilization, and we're actually able to do so much more. But we didn't actually give people the keys that they need in order to at least access what they were accessing before. And that's actually basically Thomas Paine's argument that he wrote, over 200 years ago, is that, if we're going to do that system, you can't leave people worse off than the natural state that they were in before. If we create civilization, you have to at least make it so people have the same access as they had before. And that's the importance behind UBI. And as far as like the amount of UBI, essentially freedom exists along this spectrum. And so the higher the UBI, the more freedom you're going to have. The more ability to say no to people you're going to have, and the more freedom to say yes to your own interest and pursuits and self-agency you're going to have. So it's not so much that a certain amount has to exist in order for it to be, yes or no kind of binary state of freedom or no freedom. It's that as the UBI increases, and I would argue that UBI should perpetually increase as productivity and our national economy increases, that we should all be continually, the floor should be rising so that we're always better off, we're always more free, and we always have more power to have that freedom over ourselves and our own choices.
Issue of the means of production. Like, when I look at the UBI thing, it feels like a bribe. And let me explain what I mean. We have a system where 95% of the income gains under Obama went to the top 1%. And that number is only going to get bested by Trump, which basically, as you put forward, that means that basically all of the gains that are taking place in our society is basically being expropriated to a small body of human beings that makes the determination on pretty much all of it. So you can choose between Pepsi and Coke, but you can't necessarily choose whether or not your society even wants to have a syrupy, sugary drink that doesn't basically have any nutritional value. None of those things become democratic choices. From the standpoint of a society having control of the means of production versus a universal basic income, is the universal basic income not somewhat of a bribe, but basically saying, look, if you guys allow us to continue to own the means of production and continue to make choices about how our society runs and how those resources are distributed and used, we will give you a kickback to leave us to our devices in the form of a UBI. Wouldn't it be more apt to get control of the means of production as opposed to, let's say, a basic UBI?
Yeah, so I think it's important. That's also why I talk about unconditional basic income, because if you understand the unconditionality aspect of basic income, then you understand it as more than just money. Unconditionality is, of course, a form of power. And so you can understand unconditional basic income as not, it's not just simply some redistribution of money. It's a redistribution of power itself, because you are actually gaining more power than you had before. Like if you have the power because you have access to a basic amount of resources to live, then you can go to your, big businesses and industries and they're saying, we'll pay you minimum wage to do this. Then you can say, no, I'm not going to accept that. I'm going to require a higher wage than you're offering. Or also, maybe I'm just going to start my own business. Like I have access to capital now, and people actually have money to spend at my business. And so I'm going to do that, and I'm going to compete against you. And so you can see that as being actually a means of creating more competition, and also a means of, you're able to share this capital more. So you can get 10 friends together, you can share your basic incomes together, and you've got the shared capital. You can start a business. It'll be a co-owner opportunity for all of you, and so you can compete against that big business in a way that you couldn't before. And also, you have more power as a citizen, and that's a really key factor too. Is because we know that income level is related to voting participation. So we know that people say, I can't stand in line for this. I'm going to I can't risk being able to work. I'm not going to vote. And so that's part of the situation that hurts. And people, they don't have the time to inform themselves on the ballot. They don't have time to volunteer for their candidates. They don't have the money to actually donate to candidates who actually would fight for them instead of being bought by the corporate interests. And so if you have a citizenry that are empowered to the point where they can do more volunteering, and they could donate to actually the people who represent them, and they could even run themselves in order to be that representative that works for the people, then that's where you create a system of government too, where it actually represents the people, and you can write laws that actually change the game as it is, as far as this concentration of wealth and power that has been increasing at the top. So it's a way of distributing this power in kind of a more systemic, kind of meaningful, at an individual level kind of way than just saying, all right, let's say the government owns this and does this and makes these decisions for us. It's just that we have not empowered ourselves with the ability to do these things, and that's something that we need to finally do, especially now.
Scott, we only have a few minutes left. Great conversation. I'd love to get you back on soon. I hope you're having as much fun as I think we are. I know definitely I am, and I'm sure Jamarl is too. But last quick question here. This is a little bit outside of the official bailiwick of UBI, but it's foundational to it. It's the question of automation. A lot of people were pushing UBI as a response to the increase of automation, but as far as I can tell, we haven't been having enough of that. Now, I'm not actually trying to criticize UBI. I'm trying to focus on the automation aspect. This is, again, coming at it from a weird angle maybe, but what have you seen in terms of your research, the work you've done, conversations you've had? What do you think we should be doing if we want more automation? If we want to automate more tasks, if we want to become more productive, maybe return to manufacturing. There are these different components of it, but what do you think we should do to get more of that?
Yeah, so one of the really interesting things about learning more about automation is that we've actually been automating quite a bit over the decades. And so, people think, if there's enough automation, then that means that you're going to have a lot more unemployment. And so it obviously isn't happening yet because people are still employed. But what we've been doing is we've started the heavy automation in the middle of the skill market for labor. Think like auto manufacturers. And so they become unemployed. And what do? Well, a slice of them is able to retrain and get better jobs in the high skill area. But most of them have to go towards the low skill area and get these jobs that pay less. So what we've been seeing is over time, essentially automation has been pushing wages down, and we've all been essentially competing with each other to lower our own wages in order to accept whatever we can get at the bottom of the skills market. And that's even helped create this new for a market for alternative work, which is, say, gig labor, temporary work, and a lot of these jobs that no longer have the same protections and safety net and things that we did before. So one big part of the problem and why we're not automating as much as we could is because we have not essentially freed people from the labor market and given them the power to say, look, do you want to go back into the labor market? Do you want to reskill? Do you want to re-educate? Do you want to find that better job that's being offered? Or do you want to pursue, your own?
Sadly, that is the voice of Scott Stanton's great conversation. We've got to cut it there, though. We're entering our last seconds today. We'll be back tomorrow. Again, Scott Stanton's writer, full-time advocate for unconditional basic income. Check his work out at scottstantons.com. Again, you're listening to Fault Lines with Jamarl Thomas and Shane Stranahan. Great show. We'll be back tomorrow. Hope you all have a great day. See you again soon. Fault Lines with Thomas and Stranahan.
Guys, as always, amazing show, great conversation, great guests. I love the conversations that Shane and I end up in all the time. And they tend to be good. It allows us to figure out where we stand and to make adjustments and such. So, no, so far, so good. Great guests. And, of course, great audience. Guys, thank you all for joining us. We absolutely appreciate it. 7 to 10 a.m. Monday through Friday. Fault Lines with Thomas and Stranahan. I will be back momentarily. Well, I seem to be having a problem that I need to get resolved. And so you may not see me this evening, but you will likely see me tomorrow. Like, share, and of course,